morning, ladies and gentlemen. Thank you very much for coming to the end of project event. The Health Policy Plus has done a 7-year project here in Nigeria. And of course, we have experienced resounding successes that we would not just take credit for. We extend that to you and to some well-meaning Nigerians or members of the international communities who supported this project. And that is why we deemed it necessary to gather here today to close this project in this colorful manner. So I want to say thank you. I want to say welcome to you all and say thanks so much for coming to join us at this event. Ladies and gentlemen, please, if your hands are not busy, please jam them together for yourself. Wow, thanks to those who are busy their hands to do this, because I saw some hands busy as well. Thank you. Ladies and gentlemen, we are right here at Ladekwani Hall, Sheraton Hotel, Abuja, and we will be starting the event in earnest immediately. I would like to beg you to journey with me as we go through the program of event together. Right now we have covered 2 already. We have done the arrival and poster session where we showcased some of the activities we have done in the past 7 years to you all, and I am sure you enjoyed seeing those beautiful sights. Thank you very much. I would do recognition immediately, and then we would say the national prayer and start. I would like to recognize in a very special way the Honorable Minister, Federal Ministry of Health, Dr. Osagie Ehanire, ably represented at this event by the Director, Planning, Research and Statistics, Federal Ministry of Health, Dr. Ngozi Azodo. Always a pleasure to see you, ma. Always a pleasure. We were together some months ago at Transcorp. Thank you very much for coming. We appreciate you, ma. Ladies and gentlemen, we also have the Chairman, Senate Committee on Primary Healthcare and Communicable Diseases, National Assembly, Abuja, Distinguished Senator Chukwuka Godfrey Otazi, ably represented at this event by Barrister Adesina Bello, the Senior Legislative Aide to the Distinguished Senator. Barrister Adesina, welcome, sir. Distinguished guests, ladies and gentlemen, we would be, I am not certain he is here already, but he is very much around with the members of his team, the National Agency for the Control of AIDS, DG, Dr. Gambo Aliyu. We hope that he joins us soon because he's very much around. Please celebrate him as we anticipate that he joins us. Thank you. Distinguished guests, ladies and gentlemen, we also have the Director General National Health Insurance Scheme, Professor Mohammed Nasiru Sambo. And I know I have also members of the agency, the scheme, who are also here. Please celebrate them as we hope that the DG joins us. So we begin in earnest. The Director General National Primary Healthcare Development Agency, Dr. Faiza Shaibu, is right here in the capacity, ably represented by Dr. Nneka Onwu. She is right here. Ladies and gentlemen, please put your hands together for her. Thank you very much. We also have right here, all the way, she came all the way from India, I guess, yesterday night. Okay. Thank you very much for coming, the Global Project Director, Health Policy Plus, and she is also the Vice President, Palladium, Dr. Sunita Sharma. Please put your hands together for her. Welcome, ma. And thanks for the gift of chocolates yesterday. I guess we'll make it available for everybody here today. Thank you. Distinguished guests, ladies and gentlemen, the U.S. Deputy Mission Director, Dr. Katie Donoho, is here. Yeah. Please stand for recognition, ma. Yeah, that's what they. Please put your hands together for her. She stands for recognition. Are you wave? Thank you. Thank you very much. We have also the representative of the director, USAID Office of HIV and TB Control, PEPFAR, the US President's Emergency Plan for AIDS Relief. She is Rachel Goldstein. She's right here with us, right? She's on her way. Okay, we expect that she joins us. Thank you very much. Distinguished guests, ladies and gentlemen, the country director of HP Plus, the very delectable, very, very proactive Dr. Francis Ilika, a health system strategist and health economist. Where is she? Oh, please put your hands together for her. Thank you very much, ma, for putting this together. Distinguished guests, ladies and gentlemen, Mrs. Josephine Carlo, Director Performance Management and Resource Mobilization, NACA, should be in our midst. Please wait for recognition. Okay, please put your hands together for her as we hope that she joins us. I understand that they are engaged very close to us on another event that is related to what we're doing here. Ms. Helena Mary, the USAID Deputy Director, is right here in our midst with all beautiful smile and gorgeousness. Thank you very much for coming, ma. We also have Dr. Ahmed Damfolani, CEO Fct Health Insurance Scheme. Ladies and gentlemen, put your hands together for him. Thank you very much for coming, sir. Distinguished guests, ladies and gentlemen, our list of special dignitaries is quite long, and I assure you that I have the names of all of you seated right here because you are all distinguished in your personal capacities. But then you would agree with me that if we continue to do the recognition, that might be what we would have done when it will be 12 noon. So I beg you to pause the recognition at this time and then go on with other items on the program. But that is not a way of saying that some of you who have not recognized, who have not mentioned their names, are not distinguished, are not welcome to this event. You are indeed. So, oh, well, to really give us, all of us, a sense of connection and belonging, please help me say welcome to your neighbor. Yes, you can say welcome to your neighbor on my behalf. Just a soft one. Yeah. Thank you. Yeah. Okay, do you want to do that in your local dialect? And then get an interpreter to interpret to. All right, that's fine. Dr. Emanuela, GM. Oh my God, Dr. Emanuela, the General Manager, SNMA, the Lagos. Sorry, thank you very much for coming. We appreciate you. They came all the way last month, right? They came all the way from Lagos. I will do this properly. I'll come back to do this properly. Thank you. And then, of course, we have Dr. Monsurat Adeleke, CEO, El Saka. Thank you very much, Dr. Monsurat. Thank you. Thank you very much for coming. Distinguished guests, ladies and gentlemen, on the item number 3 on our program, it's time for national prayer. We will do this first stanza of the National Anthem, and then the second stanza, that would be our opening prayer. Are you helping us, IT, or we recite? Are you helping us? Okay, at the count of 3, ladies and gentlemen, shall we please rise? We will key the IT in. If you're not helping us, then we do. At the count of 3, we go with our national anthem. 1, 2, 3. Rise, O content, Nigeria's call obey. Ladies and gentlemen, it is still the Health Policy Plus Nigeria End of Project event happening today, Thursday, 19th of May 2022 at Ladikwani Hall, Sheraton Hotel, Abuja. You are welcome. I would like to invite for a remark I would like to invite for an introduction a lady whom you would all want to hear speak. Very intelligent and smart, an achiever par excellence. My sister, my friend, who would be doing this together with me. Ladies and gentlemen, please put your hands together for her as she comes forward to tell us who she is and to give us further directive. My name is Stephen Chukwebuka also, and I am MC Frank when I am talking. You're welcome.
I'll stand on the already established protocol. Good morning, distinguished guests, and a warm welcome. Thank you for honoring us with your presence today at this highly anticipated event, the Health Policy Plus End of Project event. My name is Chidumga Ohazurike, and I am the Health Finance and Technical Advisor for HP Plus. On behalf of the HP Plus country team, I'm excited to welcome you all to this event. It's a day of celebrating our work at the conclusion of an impressive 7-year run of a global health project funded by USAID and governance and financing at different levels in Nigeria. To our distinguished guests who have joined us in person, we are honored that you chose to be here. Thank you to all our government stakeholders, our implementing partner colleagues, for all you have done to support our work. Thank you to USAID for allowing us to do this work in a manner that has enabled us to accomplish these amazing results. It's been 7 years of advancing policy formulation and implementation in the field of health policy, advocacy, financing, and governance in Nigeria. We are proud that we're able to celebrate this success with you, our lessons learned, and the results from our work. Today, we promise you a day of revisiting very proud moments, discussions on what is to come, food for thought on the opportunities that lie ahead. Today, we will sit back and take a moment to reflect on how we approach the future. The project has been about many things. It's been about equity and the firm belief that every life is worth saving. It's been about numbers from data, numbers of policies from which we. It's been about local leadership, about attention to adapt for context. It's been about innovations, new tools and approaches. And it's been about recognizing and standing beside to support the goals of our stakeholders and to articulate their goals in such a way that enables us to achieve appropriate. Actually, it's been about people, men, women, and children. The impact that has been made in the lives and in the communities where we work, who now look to a more promising future filled with opportunities. As we move forward, we're going to take many lessons from the project that will enable the building of a resilient and a sustainable health system in Nigeria. We will have the opportunity to learn about the tools, the models, and the approaches, as well as the innovations that have equipped and steered us forward in this journey towards an improved health system and better health outcomes. Before we start, I would want to remind everyone in the room that we still have posters at the back. Please find time during the tea break to still visit those posters. We'll be glad to see you there. Please find a copy of the day's agenda on your tables as well as displayed on the screen. We've also included in your folders the result briefs as well as links to our webpage where you can find more information on the project results reports, and briefs. We're also encouraged to tweet, tag, and post this event on your social media pages. Quickly going to the themes of the day. As we start, we'll receive welcome remarks from the Federal Ministry of Health. Then the keynote address will be by Dr. Sunita Sharma, the Global Project Director of HP+. We'll also receive remarks from our very important stakeholders, to include the members of the NHIS, the MPHCDA, including state representatives from Lagos State, who have come all the way as a witness to this important legacy, as well as USAID representatives. We'll also hear from the country director, Dr. Frances Ilika, as she presents the HP Plus Nigeria program results. Thereafter, we'll have two very engaging panel discussions. The first panel discussion will be on advancing UHC reforms through domestic resource mobilization mechanisms. And the second panel discussion will be on sustaining Nigeria's HIV response. Our eminent panelists are policy, and they will be sharing deep insights that has enabled the progress that we have achieved so far. As part of the activities of the day, we'll also be giving special recognition to some of our stakeholders who have led with impressive zeal and has made this work to move forward. For all contributions made and collaborations enjoyed from all our stakeholders, we say thank you. Our hope is at the end of today, we'll leave here confident, armed, and ready to take on the remaining work on this continuous journey towards that world of opportunity where everyone is empowered to achieve their best potential in life in an environment of a strong resilience and sustainable health system in Nigeria. Thank you, and a warm welcome once again.
Thank you very much, Dr. Chidumga Ohazulike. Thank you very much. Appreciate you. Ladies and gentlemen, we are moving on to the next item on the program. But then I have been asked to recognize Dr. Usman Guarzo, National Team Leader, Lafia. He is right here. Thank you very much for coming, sir. We appreciate you. Distinguished guests, ladies and gentlemen, we have a handful of other special dignitaries who are on their way to join us at this event. It promises indeed to be a very successful one. I would like to, at this point, invite the Director, Planning, Research, and Statistics, Federal Ministry of Health, Dr. Ngozi Azodo, to kindly come forward on behalf of the Honorable Minister, Dr. Osagie Hanire, to give us a welcome remark. Ladies and gentlemen, give her a ministerial applause as she comes forward to address us. Thank you.
Thank you very much. I'm quite honored to be here. So I think the protocol has been established. So I want to stand on the existing protocol so that we can save on time. This is the end of projects for the Health Policy Plus, and of course, the beginning of another project. Is that correct? Please, it's the beginning of another project. Can we clap? The USAID is here, and I want to acknowledge them very specially, even though we already stood on existing protocols. Because if we want this project to continue and to expand, we have to be mindful of those who pay the piper so that the tune and the dance can continue. I want to also, this is political season, so I want to acknowledge the presence of the Senator Utazi, who is ably represented here by the aide. So since this is the end of project meeting, I want to thank the project director and the USAID for this wonderful project. This project has done a lot. I mean, everyone here is part of establishing and implementing this project. So I'm not going to talk about what it is about. You know, we know it's a flagship project of the USAID. But we also know that as part of what it did for the health sector, it has helped us to strengthen our health system. And so we must acknowledge that. Can we clap for USAID and Health Policy Plus for all the work they have done? It's not enough for me to say they have helped us. I can list some of the things they have done, okay? And so we are looking at helping us to strengthen our health system, health and the National Health Insurance Scheme and MPACDA to develop and roll out a joint training guide, training of trainers and facility training on the Basic Healthcare Provision Fund. I think they trained about 230 people ab initio who have gone on to train over 30,000 others. That is critical for our health system, because one of the biggest challenges we are having now is challenges the attrition of human resources. So because of the vision that they had, this happened since about 2018, 2019, before even we knew that we were going to get this to this point before COVID. So can we give them another round of applause? The HP Plus also built the capacity of over 3,000 primary health care centers and ward development committees. I mean, the ward development committees are at the heart of the primary health care delivery. And all this while, we've been struggling with how to ensure that they have the capacity to do what they are supposed to do. And now, because their role had become very urgent, and so the HP Plus, working through this project had also helped us to strengthen that. The HP Plus also is working with us to look at the the accountability, the financial sustainability plan for HIV/AIDS, TB, and malaria. I mean, that is key to even releasing or lifting the additional safeguard that has been placed on Nigeria by the Global Fund. And this is a critical piece of work that we expect will help us, as a country, to further strengthen our health system. These are just a few of the things they have done. And I know that other people will list all the many things they have done to assist us. But I also think that one of the best things they also did was giving us the project director. So I want to commend the USAID. And I think we should give a round of applause for Dr. Lika. Please, can you stand up so that we can see you? I think we should commend her. Please keep standing. This is the minister talking now. So you keep standing. I want to talk about her because it's important for us to know the place of leadership in project implementation. And I single her out, not because she doesn't have a team, but she and her team. So her standing here represents everyone who is part of the team. So can we also acknowledge the other members of her team who are here? Please, can you stand up if you belong to HP Plus? Just move forward a bit. Give us 30 seconds of your time. We want to acknowledge you, and we want to acknowledge all the great work you've done. I think this team has been, not just smart, they have been resilient also, and they have been very transparent and accountable. And I want to commend them and encourage them, going forward to, like we say in my place, Jide Kiji, just keep it up. I don't know whether that is the word I want to say, but it's like get better, keep building on what you have already. So please, you can sit down. Thank you very much. So going forward, we expect that having gone through the COVID experience, all of us, and by the way, the COVID-19 pandemic is still with us. It hasn't gone away. We still know that some parts of the world are re-entering lockdown. So while we thank God for the opportunity to be able to come here and be as normal as is possible in the circumstances, including seeing our faces and not wearing our face masks, I think we must keep that at the back of our mind, and the lessons of that COVID pandemic cannot be wished away. And so, as we end this project, I want to also say that the government of the Federal Republic of Nigeria is responding to the COVID experience. And so, rebuilding our health system, having a resilient health system, is our number one priority. And so, for everyone who is working on this project, who has helped us to build our health system, we thank you. Going forward, we know that we expect the following things from all of us. Number one, building a resilient health system. Number two, building a resilient health system. And number three, building a resilient health system. So we look at the health system and the implications of that for the health sector and for all of us. The implication is that we must have human resources for health, and we have been very challenged during the COVID because of not just the inadequacy in numbers of the human resources, but the continuous exit of those that are available, and the reduction in the requirement criteria to exit the country, and of course the differentials because of economic realities in wages and workplace conduciveness. So it's important that we encourage our partners to again focus on issues around human resources for health. Speaking to that is primary healthcare systems. We can't overemphasize the need to build a primary healthcare system. We may disagree on strategy, but the primary healthcare system is at the heart of the health system. So every support to the primary healthcare system is key to not just our recovery, but protection of our health going forward. And a number of things come to mind very, very quickly. We must, in addition to having our human resources, but look at how the system at the subnational level can be sustainable. Building everything from the national level is not sustainable. So even if we have to expand our agencies and expand them and grow them and all of that, and we do not have the primary healthcare providers at the local government level and at the community level, we are not going to be able to have that sustainable. So as part of our resource mobilization effort, as part of our health system building effort, we must have innovative ways to bring in the subnational government into taking full responsibility for primary health care and for human resources, so that what they get from the national is additional support and technical assistance, to make that sustainable. So we have all these, all these ideas that are going on. So we need to really think through, how do we, in the kind of government we run, and this is political season, so it's very important, the kind of government that we run as a country, how do we mobilize the support of governments at the subnational level to take full responsibility for primary health care? If you look at the Nigerian law, like we all know, health is on the residual list. It's not on the concurrent list. It's not on the exclusive legislative list. And when it is on the residual list, we are told by lawyers and parliamentarians that means it's a local government activity. And we ask ourselves, are the local governments taking responsibility for health? So part of what we need to be doing going forward is making sure that we find ways, innovative ways, legal ways, legitimate ways to strengthen the local government to take full responsibility for primary health care, and then we support them to do that. We can't go too far without that. And then, of course, the issues around the local manufacture of all the things we need. Thank God, in the last 3 months, the WHO had identified Nigeria as one of the spokes for the production of for the acquisition of the mRNA technology. And we're working on that to ensure that we actually actualize that. We have a public-private sector partnership, PPP arrangement, which BVNL is a joint venture company, is representing Nigeria in that spoke. However, the mRNA technology goes beyond just one company. It is a technology that can impact on every area of our lives. But it's not going to be able to impact on every area of our lives if we do not have the appropriate framework, if we do not have the appropriate research institute, if we do not have the capacity to translate the technology into locally available technology. And so all the issues around local supporting that becomes important. We saw the issues around vaccine nationalism and all the other nationalism that came forth with the COVID. And honestly speaking, there's nothing really wrong with that if we must tell us yourself. I mean, it's like being in an aircraft, right? The pilot tells you to wear your own oxygen mask first, right? Before you take care of anybody else, including your own children, your underage children. So, but the import of that is that it tells us that the way we function as a country needs to be retooled. And so we're looking at that. How can we strengthen our local capacity to be resilient at all times and to be able to contribute to what the world is doing? So on that note, and there are so many things I want to say, I have a list of that HP Plus helped us to support. But I think that what is important here to acknowledge that they have done a lot and to acknowledge the quality of leadership. So say that, like Oliver Twist, what did Oliver Twist say? Huh? No. Some more. And when you want some more, you don't want it in small quantities, right? Not less than what you had before. You want it in bigger quantities. So I think that on that note, I want to thank the HP Plus team and the project director. And to also acknowledge, I left this for the last because in my place, the big masquerade dances last. So the global director for HP Plus is here. And so she's the last person we are going to acknowledge. Please, forgive me for putting you hand up so that we can acknowledge the global director of HP Plus. This is how important this is. And I'm happy that you are here so you can hear me firsthand. If you want me to write you a letter to document what I've said, I'll do that. So it's important that you've heard what we've said. You've been a great ally and a great team, and we're very grateful for the work we've done together. We are also, and we're asking that you expand your scope within Nigeria and help us to address the issues around building a national health system. I believe in another 4 years after this next project, we're going to come back. I'll be in the private sector then. I would have left the Ministry of Health. So we'll come back here to celebrate a bigger success. Thank you very much and God bless you.
Thank you very much, Ma. We appreciate you. Ladies and gentlemen, please put your hands together for the Honorable Minister, Health, Federal Republic of Nigeria, ably represented by the Director, Planning, Research and Statistics, Dr. Ngozi Azodo. Before we continue, I would like to invite the Honorable Minister back to the stage. Ma, please, and then the dignitaries kindly come forward and take a shot with the Honorable Minister before she takes her leave. Dr. Sunita Sharma, ladies and gentlemen, put your hands together for her as she comes forward.
So I'm so pleased to be here today to the Federal Ministry of Health, National Assembly representatives, National Agency for the Control of AIDS, National Health Insurance Scheme, National Primary Health Care Development Agency, Government Is it not working? Working? Yeah. So impressively, this work has moved forward even during the past 2 years as the HP Plus Project Nigeria team adapted to the circumstances presented by the global COVID-19 pandemic. It has been my immense honor to lead the Health Policy Plus project for the last 7 years.
She's far from you.
Who helped guide our path. Policy work is the backbone of everything we do. Well-financed and I would say resilient health system, high-quality service delivery, equitable access to care, improved health outcomes, transparency of information and data, it all can be traced through policy. Policy matters. So HP Plus has had a significant global impact worldwide. We have collaborated with nearly 1,700 partners across 49 countries to achieve more than 2,000 results. And when I'm talking about HP Plus results, they are very high-level results. So policies adopted, operationalized, domestic resources mobilized, efficiencies improved, better transparency, accountability, strengthened stewardship, all of those are important aspects of the results we achieved. So this includes the mobilization of over 465 million in domestic health resources and $1.4 billion mobilized by countries from the Global Fund and other donors. We have supported the development and implementation of 100 policies, including laws, regulations, strategies, and focus on localization and capacity strengthening. And by following the lead of our local teams and partners. As we will hear today, HP Plus collaborated with the federal and state governments to drive toward universal health coverage by accelerating the rollout of Basic Healthcare Provision Fund, health insurance expansion, and primary health care under one roof, conducting financial analysis, bringing evidence to decision making, and building the capacity of local health teams and community networks has led to impressive results. We now see more people enrolled, increased coverage, and reduced out-of-pocket payments. For instance, for people living with HIV in Lagos State. One way we have helped strengthen the health system is through our commitment to financial sustainability and good governance. From Indonesia and Cambodia to Kenya and Nigeria, HP Plus team has collaborated closely with our local partners to boost health sector management and accountability, assess financial gaps, and identify feasible strategies for raising domestic resources. Our work also really required engagement of ministries of finance. For example, in Indonesia, we designed monitoring and evaluation framework for the National Insurance JKN program for Ministry of Health to be able to see whether it's equitable, efficient, and financially sustainable. In Cambodia, our work involved working with Ministry of Economics and Finance, really making sure that social protection mechanisms are fully operationalized. For that, also designing monitoring and accountability framework, working with the Ministry of Finance or Department of Treasury in Kenya to make sure that the PFM, which is Public Financial Management Act, is fully operationalized and program-based budgeting is really institutionalized in different counties. So in each country, this issue is unique, but HP Plus has been positioned to listen, learn, and adapt tools and approaches to support the goals articulated by our local partners and to ensure they are appropriate, contextualized, and locally owned and sustainable. So I'm looking forward hearing more from Frances and her team as we can shine a light on our partnership in Nigeria. And I really want to thank USAID for giving us opportunity to work in Nigeria. It has been a great experience. Thank you very much.
The Executive Secretary and Chief Executive Officer, National Health Insurance Scheme, Professor Mohammed Sambo, joined us in person. Ladies and gentlemen, put your hands together for him. Thank you very much for coming, sir. We appreciate you. Thank you for joining us. I would like to invite the ES. I don't know if you need some time to relax since you just walked in, sir. If you don't, I would like to humbly request that you kindly mount this podium to, no, the ES, please, to speak to us. That's correct? Okay. Thank you very much for coming, sir.
Let me align or stand on existing protocol because I'm just coming. I always would love to give a rundown of the protocols. I know that the representative of the Honorable Minister is here represented, the representative of the House Committee on Health, the country, the global Director of Health Policy all the way from DC. Distinguished ladies and gentlemen, good morning. Good morning. It is my great privilege and honor to celebrate the USAID Health Policy Plus project achievements over the past 7 years in advancing healthcare financing reforms in Nigeria. Nigeria has continued to make significant progress in healthcare financing reforms to increase domestic resource mobilization for health and improve access to quality healthcare services across the country. As we are all aware, the National Health Insurance Scheme is the agency of the federal government responsible for ensuring with the global and national vision for digital transformation. Number 4, development of the National Health Insurance Scheme Medicine Supply Initiative, which will improve the availability and affordability and acceptability to quality medicines. Number 5, development of health insurance under one roof, which serves as a coordinating platform for the health insurance activities in Nigeria. And number 6, various internal reform that has to do with improving the financial management system, improving the technical capacity of the National Health Insurance Scheme, and addressing numerous hydra-headed health human resource problems within the organizations. But despite all these achievements, we are not resting on our oars as we continue to strive towards attainment of universal health coverage in our country. Under the able leadership of President Muhammadu Buhari and the visionary leadership of our Honorable Minister of Health, Dr. Emmanuel Osagi Ehanire. One of the critical success factors has been the strong partnership we have with development agencies, particularly the USAID Health Policy Plus. Health Policy Plus has a unique approach of promoting local leadership, alignment with government policy, inclusivity and multi-sectoral partnership at every level, which has led to the remarkable successes recorded in the expanding health insurance coverage across Nigeria and ensuring provision of quality health system with financial risk protection. Over the past 7 years, even before I took over as the 12th Chief Executive Officer of the National Health Insurance Scheme in 2019, the relationship between USAID, HP Plus, and National Health Insurance and many state health insurance agencies has catalyzed a lot of reforms that we see today. HP Plus has supported the catalyst in the acceleration of state health insurance implementation at sub-national level, especially the Federal Capital Territory, Abuja, Osun, Ebonyi, and Lagos State. This support was done in the area of facilitation of enactment of social health insurance laws, establishing the agencies and boards, supporting the development of operational guidelines and manuals, including business plan and treatment guidelines, as well as developing strategies for covering the informal sector. States were also supported to conduct fiscal space analysis and improve domestic resource mobilization for their schemes through payroll deductions, equity funds, informal sector contribution, and innovative financing. HP Plus has provided guidance for state health insurance agencies to develop or revise their health insurance benefit packages and determine premiums while strengthening their operational, technical, and institutional capacities. HP Plus has conducted actuarial analysis of health insurance schemes and supported state health insurance agencies to use the findings to develop sustainability projections. HP Plus has advocated for and supported integration of state health insurance agencies governing boards and in several states. Most importantly, HP Plus has helped to catalyze the operationalization of basic healthcare provision fund by developing and piloting BSCPF training curricula and trainers and implementers. This has assisted FCT Ebonyi, Abuja, and Osun State to qualify to benefit from the first tranche of the basic healthcare insurance fund. Subsequently, the 230 trainers have trained many others across several states in the country. NHS staff who are among these trainers are constantly transferring these valuable skills to their colleagues. These and many more reasons are why we gathered here today to celebrate HP Plus Nigeria end of year project. It has been a tremendous success. At this point in time, I wish to thank the USAID, the HP Plus, and the country teams and the implementing partners for the rewarding partnership and support that we have enjoyed from this project. I believe that this event provides us an opportunity to learn vital lessons and contribute to the future direction in expanding health insurance coverage, improving domestic resource mobilization for health, and making good progress toward attainment of universal health coverage. I wish you success in all future endeavor. Thank you, and God bless all of you.
Distinguished guest, that was the Executive Director and Chief Executive Officer of National Health Insurance Scheme, Professor Mohammed Sambo. Please celebrate him once again. Distinguished guests, if you're joining with me on the program, you would know that we are right here at the keynote address, speeches by esteemed dignitaries session. That is why you are hearing speeches. And the hall at a point gets rowdy, and we wouldn't really, that does not favor us. Please, it's not really time to exchange pleasantries at this time. It's time to listen to our distinguished guests as they speak to us. Thank you very much for your understanding. At this point, I would like to invite the Deputy Mission Director, US Government, Dr. Katie Donoho, not a doctor now, Katie Donoho. Thank you very much for coming. Appreciate it.
Good morning, everyone. I'm very pleased to be here. Government of Nigeria, heads of ministries, departments, and agencies, implementing partners, distinguished guests. And as I have learned to say in Nigeria, my favorite phrase, all protocols duly observed. It's like a catch-all that gets you out of trouble. Good morning. I'm delighted to be here with you all today at the Health Policy Plus End of Project event. It provides us all with an opportunity to reflect on the achievements, lessons learned, and next steps for building a more sustainable HIV response. To begin, I join each of you in celebrating the tremendous successes and gains that the national HIV and TB programs have achieved over the last few years. More than 1.7 million Nigerians are currently receiving life-saving HIV treatment, and remarkable strides have been made in TB case detection and treatment. These achievements are even more impressive given that they occurred in the midst of the COVID-19 pandemic. Over the last few years, USAID's HP Plus project has filled a critical gap. We have partnered with the government of Nigeria to provide technical assistance to several Nigerian agencies, including the National Agency for the Control of AIDS, NACA, the National Health Insurance Scheme, and the State Health Insurance Scheme, to improve the sustainability of HIV/AIDS and TB response. Let me share a few notable achievements of this project. The development of a national blueprint for the integration of HIV and TB into the National and State Health Insurance Scheme. The successful integration of HIV services into the Lagos State Health Scheme, and we're very glad our colleagues from Lagos could join us for this. As of February 2021, Lagos State residents were able to access HIV testing, clinic consultations, and treatment medication refills covered by the Lagos State Health Insurance Scheme, which is really a remarkable achievement. Congratulations. Health insurance in Lagos State now covers 600,000 Lagos State residents, including vulnerable and key populations. HP Plus contributed substantially to the development of the National Domestic Resource Mobilization and Sustainability Strategy, this is a mouthful, for HIV from 2021 to 2025 that plans to mobilize more than $600 million by 2025 for HIV response in Nigeria. The US President's Emergency Plans for AIDS Relief, or PEPFAR as we call it, has already invested more than $6 billion in Nigeria's HIV response, which is a tremendous amount of money. Through HP Plus and other projects, we are increasingly focused on working with our Nigerian counterparts to mobilize more domestic resources from the government of Nigeria. USAID is confident that our valued partners are well positioned to build on the accomplishments of HP Plus. We are also assured of the government of Nigeria's continued commitment to make adequate funding available for HIV, AIDS, and TB. USAID commends and thanks you for your support in making the HP Plus project a success. Your dedication and commitment to broadening access to HIV and TB treatment for all is truly inspiring. Thank you again, and let's keep the momentum going.
Distinguished guests, ladies and gentlemen, the DG NACA, Dr. Gambo Aliyu, is right here with us. Please put your hands together for him. You're welcome, sir. Thank you very much for sparing time out of your very busy schedule to join us. We do appreciate you sincerely. At this point, I would like to bring on, right now, from the National Assembly, the chairman Senate Committee on Primary Health Care and Communicable Diseases in the 9th Assembly, distinguished Senator Chukwuka Godfrey Otazi, ably represented at this event by the Senior Legislative Aide, Barrister Adeshina Bello, for his own remark. Ladies and gentlemen, please put your hands together for him. Thank you.
Good morning, distinguished guests. The representative of the Honorable Minister of Health, DG Naka, the Global Project Director at Policy Plus, the Executive Secretary, NHIS, distinguished ladies and gentlemen. I'm standing in on behalf of my boss, His Excellency, distinguished Senator Chukwuka Otazi, who is unavoidably absent today. He asked me to convey his profound apologies for his personal presence here. That's due to the fact that at this time, we are all aware this is a time of intensive political and electoral activities in the country. He's a ranking party member of PDP, and they are making preparation for the primaries that is coming up very soon. Having stood on the existing protocol, as a way of background, I want to say that most stakeholders, or all stakeholders in the health sector, are aware that all the race that we've been running, both the ministry and the agencies and the other organizations, has been towards the accomplishment of the universal health coverage. And it was realized that to be able to accomplish that, it is important as a strategy to have what is called the National Health Insurance Scheme. Because the whole essence of universal health coverage is to allow so many people to have access to affordable health care. But when it was realized that having access to affordable health care cannot be achieved if the cost of health care is prohibitive, that was what brought about the idea of NHIS. Even as we speak, it has been reported that between 5 to 10% of the entire population is still being covered by NHIS. And the challenge here has been that how do we enhance funding so that out-of-pocket healthcare costs will be reduced for citizenry. That was where Health Policy Plus came in. Because since the funding element has been a driver of accessibility and coverage, a lot of reforms were embarked upon to improve the situation, and the Health Ministry and other stakeholders have spared no effort in that behalf. As we speak now, Nigeria has made significant health financing reforms to increase resources for health and extend high-quality primary health care services across the country. Despite these gains, the country faces critical challenges as it progresses towards universal health coverage. Its population's out-of-pocket spending on health is still among the highest in the world. Health insurance coverage and government spending on health is also considerably low. Recent major health reforms like the Basic Healthcare Provision Fund, which aims to increase resources for health and extend primary healthcare services across the country, represent important new funding sources, as do state-level health insurance schemes. Building on the momentum of its recent health reforms, Nigeria is now exploring more ways to integrate HIV and TB care into existing insurance programs. Now, expanding sources of funding for achieving coverage is one of the key roles of the USAID Health Policy Plus Nigeria. And since they launched the project just being concluded now, a lot has been achieved. We are aware that HP Plus has since 2015 supported government and health agencies in Nigeria to conduct evidence-based advocacy, to develop and modify policies, to establish monitoring and accountability structures, to strengthen health financing and reduce reliance on foreign donors. They have also helped in the assessment of financial gaps. They have also been able to help in identifying feasible strategies for raising domestic resources. They have also helped in integration of TB and HIV into national and state health insurance schemes. We are also aware that HP Plus worked with some states of the Federation to improve service quality under the Primary Healthcare Service One Roof Policy Initiative. The aim of this is to bring the state-level agencies into the same roof, because achieving any progress at the national level without concrete proofs at the subnational level may not really drive home the outcomes. And so far, about 685 centers have been impacted to that extent. And I want to believe after this one, probably there will be another successor project to continue to drive home the achievement. Some of the states include Lagos, Kano, Adamawa, Osun, Ebonyi, FCT, amongst others. At this juncture, let me congratulate Health Policy Plus and the USAID for all the support services you have rendered to the government and the health agencies in the country. However, if it is still possible to design a successor project for the next few years to see how we can drive from the present mileage to the destination of universal health coverage, I urge the concerned stakeholders to explore this. The more coverage under the NHIS, the wider coverage under the universal health coverage. Thank you, and God bless you all.
Distinguished guests, ladies and gentlemen, that was the Chairman, Primary Healthcare and Communicable Diseases of the 9th Senate, Distinguished Senator Chukwuka Otazi, ably represented by the Senior Legislative Aide Barrister Adeshino Bello. Put your hands together for him for that remark. Thank you. I would like to, at this point, invite the Director General, National Agency for the Control of AIDS, Dr. Gambo Aliyu Gomel. He is right here with us. Please put your hands together for him as he comes forward to address this audience. Thank you very much for coming, sir.
The Chair, House Committee on Communicable Disease, represented by his Senior Legislative Aide, my friend and brother, the Executive Secretary, National Health Insurance Scheme, USAID Mission Director, representatives I can see from the U.S. Embassy, as well as development partners that are here. Permit me to stand on a protocol that has already been established. It's a kind of event that is taking place together at one place. I have my event here going on for the last 3 days, and then I just stepped out to see my boss off. My director dragged my hand and said, "There's another event here for you to say something." I said, "Okay, I won't mind saying it. Do you have something for me to say?" They said, "Yeah." So I'm going to read some of those laudable things that my director put together, that Health Policy Plus has been supporting the National Agency for the Control of AIDS in our mandate to control HIV in Nigeria, as well as establish structures for sustainability. At the same time, how this help has been extended to some of our notable states, especially Lagos states. I'm pleased to be part of this end of project event and wish to commend USAID supported Health Policy Plus project for the work it has done in Nigeria since 2015. The support for ownership and sustainability of the HIV response through this project at the national and subnational level is highly commendable. I wish to acknowledge and applaud Health Policy Plus for supporting NACA in the following areas: development of national domestic resource mobilization and sustainability strategy for HIV 2021 to 2025. This strategy articulates key strategic and innovative approaches to address the current gap in domestic resourcing and financing of HIV prevention and treatment interventions in Nigeria. Implementation of this strategy can mobilize over $600 million for HIV control from domestic sources by 2025. A key pillar and strategy proposed to mobilize domestic resources for HIV in Nigeria is the local manufacture of HIV commodities in Nigeria. Health Policy Plus further developed a technical memo that examines the feasibility of local production of HIV commodities in Nigeria and provides recommendation for decision-making in this regard. Currently, Health Policy Plus is supporting NACA to convene a multi-sectoral roundtable meeting with various stakeholders, including government agencies, donors, pharmaceutical manufacturers and associations, private and civil society organizations, and other relevant bodies to advance discussions on local manufacturing of HIV commodities in Nigeria. Health Policy Plus supported inauguration of the Domestic Resource Mobilization Technical Working Group for HIV to coordinate and engage with multiple stakeholders within the space to carry out evidence-based advocacy and enhance best practices for domestic resource mobilization for HIV control in Nigeria. Health Policy Plus supported the development of national blueprint for HIV and TB integration into health insurance and provides guidance to states on integrating HIV and TB into health insurance, a makeup for sustainability of HIV and TB responses. Permit me also to commend the support given at subnational level to Lagos State by Health Policy Plus as follows. Health Policy Plus helped the development of state strategic roadmap for the integration of HIV services into the Lagos State Health Policy Scheme. This support has helped advance HIV service integration into the State Health Insurance Scheme with client-initiated testing, service charge for clinic consultation, ARB refill, and counseling that are included in the benefit package. Health Policy Plus have strengthened the capacity of Lagos State Agency for the Control of AIDS and State AIDS and STI Control Agency to develop program-based budgets, submit evidence-based and compelling fund request memos to engage with the different multiple government agencies to facilitate the timely release of funds for HIV control in the state. This led to an improved budget performance in the state with a 32% increase in budget allocation for Lagos State on HIV from 2018 to 2021. I wish all partners and stakeholders here present a successful event. Thank you.
Ladies and gentlemen, please put your hands together for him once again. We appreciate you, sir. Dr. Gambo Ali. Ladies and gentlemen, at this point, I would like to bring up on stage the Executive Director, National Primary Healthcare Development Agency, Dr. Faiza Shaibu, ably represented at this event by the Director, Primary Healthcare System Development, Dr. Neka Onwu.
The Honorable Minister, Dr. Osage Hanire, ably represented by the Director, Planning Research and Statistics, Dr. Azodo. The Chairman, Senate Committee on Primary Healthcare, Senator Utazi, ably represented. The Executive Secretary, NHIS, Professor Sambo. My brother, the DG NACA, Dr. Gambo Aliyu. Directors of government agencies at national and state level, the Global Project Director, HP Plus, our partners, distinguished ladies and gentlemen. I'm sure it's okay to align with already established protocols. I bring you warm greetings on a very cool morning from my Executive Director, Dr. Faisal Shuaibu. He directs that I convey his apologies that he's not here, but I'm also honored to be representing him at this particular meeting. If you hear I'm referring to Dr. Faisal Shuaibu. He says, I am delighted to be here at the USAID Health Policy Plus End of Project Learning Exchange event to celebrate the successes and remind ourselves of the progress made on the path towards achieving universal health care in Nigeria. NPHCDA congratulates the global and country leadership of the USAID Health Policy Plus project for steering the course of this project in the last 7 years. For us at the National Primary Healthcare Development Agency, with HP Plus, it has been a journey of partnership and collaboration to advance significant healthcare reforms in Nigeria, including the implementation of the primary healthcare under one roof, PHC revitalization, and as we've heard a lot today, the Basic Healthcare Provision Fund at the national and subnational levels. NPHCDA recognizes the reforms are critical to ensuring access to quality healthcare for all Nigerians at the lowest level. Working with policy leadership by the NPHCDA for the institutionalization of PHC under roof in states, which was the PHC under one roof was a policy of the NPHCDA in 2011 that defines one management, one plan, one M&E. And this, we believe, ensures that we have access to high quality care when we have a structure that is coordinated through one platform. The Federal Capital Territory, Abia, Ebonyi, and Osun states were supported to develop and implement operational frameworks for their state primary healthcare domain agencies, regulation for agency laws, unified annual operational plans for all local government areas in each state, and a minimum service package. In addition will be the investment plan and the human resource for health strategy policy for each state level agency. All these, you will agree with me, are vital to achieving and advancing the PHC under one roof. Using evidence-based advocacy, HP Plus also supported our state primary healthcare boards to successfully engage the political class and finance ministries to allocate and release additional government funds for primary healthcare revitalization in these states. And the FCT, that is Osun, and those that included as well as FCT. In addition and furthermore, HP Plus also engaged each state to reposition primary healthcare related programs under the authority of their state primary healthcare domain agency. They also successfully advocated for the establishment of the local government health authorities and building their capacities as well as strengthening the ward development committees. These efforts led to improvement in the governance and performance of our state's primary healthcare system, with each of these states showing improvement in annual scorecard for PHCs. The HP Plus supported states recorded some successes in terms of improvement for their scores, where they were started off with 23%. As we are seeing 43% increase in this state, so this is commendable. In addition, also, they provided technical support in collaboration with the National Primary Health Care, the National Health Insurance, and the Federal Ministry of Health, and some of our other partners to develop and pilot the Basic Healthcare Provision Fund training curricula for trainers, for which was subsequently updated and utilized for the training. We've heard much about the number of people who were trained at national as well as at the PAC level. 3,200 PAC staff trained, and also the ward development committees were trained, in addition to 230 core trainers that were trained in these states. These core trainers have gone ahead to also impact on the Basic Healthcare Provision Fund capacity building by cascading to other national training and to all states in the course of implementation by the MPACDA Gateway in collaboration with our NHIS counterparts. With their immense support to the government and MPACDA to these very focal states and FCT, it's enabled us to meet the criteria for assessing the Basic Healthcare Provision Fund early, including support to setting up relevant facility accounts, baseline facility assessment, studies, quality improvement, and business improvement plans, and also establish and build the capacity and strengthen our WDCs and local government health authorities. Working closely with the leadership of the National Primary Health Care, this set of supports spanned multi-levels, and it also accelerated the Basic Healthcare Provision Fund implementation and facilities readiness to provide quality health care to enrolled beneficiaries in the HP Plus supported states, those making them the first states in the country to receive approval to disburse the Basic Healthcare Provision Funds to facilities and commence the Basic Healthcare Provision Fund implementation. So today, as we celebrate the results and reflect on lessons from HP Plus, I would like to join my Honorable Minister where she says she's Oliver Twist. I'll go with Olivia Twist. We want to be Olivia Twist. We're asking for more. We're looking for more support from our partners, from all, working together with government to ensure that we have transformed our PHC. A few weeks ago, National Primary Healthcare had our summit, which was a transformation agenda summit that we had. And we are looking to having a stronger health system, especially with in this peri-COVID era, looking at health security and what is happening around us. We want to be a stronger nation in terms of our health, and where we are also all accountable to one another, not only government, but our partners and government are accountable to the outcome and the results that we have. So as we celebrate and congratulate you, we are looking forward to more. And we're looking more support to government for a stronger system. When you come again, I'm sure the results will be more. We'll be 43%, we're looking at 100%, and then also celebrating with one another. Thank you very much.
Distinguished guests, is still the Health Policy Plus Nigeria end of project event. It is happening right here today at Lade Kwani Hall, Sheraton Hotel, Abuja. And this is me, MC Frank Ozo. It's a pleasure being in your midst. We would run down a little bit of the safety protocol that the hotel management has given us when I return. Because at this time, I have to hurriedly welcome to the podium the country director, HP Plus. I would call her Her Excellency, Dr. Frances Elika, the very goal-oriented woman who is just awesome.
The Honorable Minister for Health, represented by the DPRS, the Executive Secretary of NHIS, members of the House of Assembly, DG NACA, MPHCDA EDU ably represented, USAID Deputy Mission Director, state dignitaries, distinguished heads of institutions, please kindly permit me to stand on existing protocols. So it's with great joy and honor that I stand here today to celebrate with all of us the great achievements of the USAID-funded Health Policy Plus project. But all those great achievements would not have been possible without the excellence, partnership, and collaboration from the government of Nigeria, both at the national level and at the state level. So I stand here to share with you, within a very short time, which is almost an impossible task, the results that we achieved, reflect a little bit on the lessons, and then forge a way forward towards how we can make this into a Nigeria that is befitting for all of us, where everyone, as long as they are a human being and they are in Nigeria, would have access to the best quality healthcare that they need, have best outcomes to go out there and live their best lives and contribute their best to the society. So before I start, I would like to show us just a very little video of why policy is important in what we call our Why Policy Matters video. Please, I crave your indulgence to listen to this for a short while.
Less than 5% of Nigerians have health insurance, and more than half of Nigerians live on less than $2 a day. These facts, combined with high out-of-pocket health expenses, mean women, children, and their families are unable to access quality health care. The result? Nigeria has some of the world's worst rates of maternal and child mortality. These rates are indicators of a population's overall health. To change them, Nigeria's health system must change. And under new reforms brokered by health advocates and government agencies, it is.
We work in the community and we see how people are dying needlessly for things they could actually walk into well-equipped primary health center and get service.
I want to see our women deliver safely without any complication, and also to see that all our children from 0 to 5 live a healthy life.
Nothing was working. There was no coordination, the governance was poor, and we were not able to achieve what the positive health indicator should be.
When the government passed sweeping reforms, known as the Primary Health Care Under One Roof and the Basic Healthcare Provision Fund, real change began as dedicated advocates helped turn the policies into action.
The aim of Basic Healthcare Provision Fund is to provide quality care and at the same time reduce out-of-pocket expenses. And this is packaged in the direction of universal healthcare coverage. While primary care under one roof is designed to streamline the governance structure of primary care delivery in Nigeria.
Before any state can take part in the Basic Healthcare Provision Fund, there are guidelines and there are requirements. So one of the most important requirements is that both the state social health insurance scheme and the primary health care board must be backed by law.
Funding is already available to support these requirements, and work is underway. National agencies coordinate and strengthen the capacity of the state, local, and facility-level workers tasked with implementing the reforms. States and local government areas establish their social health insurance schemes and governance structures. Health facilities draft quality improvement and business plans to revive their clinics. And town hall meetings raise awareness about the reforms and encourage people to enroll in insurance schemes.
For the first time in 30 years, we were able to actively engage the stakeholders at the community level to be able to accept and assess this program. Within 1 month, we have enrolled over 40,000 in the FCT.
For me personally, it has been a life-changing experience. We have gone around to a couple of facilities. We have seen tremendous changes.
Thanks to these reforms, primary health care centers across Nigeria are improving their quality of care. They are beginning to see their electricity restored, more medical supplies stocked, and more patients arriving for services.
The day before yesterday, we went to the primary health care in Akionu. God gave us a bouncing baby safely without pay anything. We thank God. We want the government to continue with what they are doing.
more Nigerians can experience these important health benefits with accelerated implementation of the Basic Healthcare Provision Fund. By 2022, child and maternal mortality rates could drop significantly, saving thousands of lives and improving the health outlook for all Nigerians.
My hope for my family and the community, they will have access to the health facility and access quality health care.
It means that everybody, everywhere, will be able to get the kind of health services needed that is of right quality, at the right place, without suffering from financial hardship. And that's what Basic Healthcare Provision Fund has come to do.
We can save lives when we work together. Better policy for better health.
Thank you very much for your audience, ladies and gentlemen. I think it was important that we saw that so that we could hear firsthand the witnessing from the communities, from the people. When the speaker spoke early in the morning, he said it's about people. It's about men, women, and children in communities who do not have the opportunity to sit in a hall like this like the rest of us. It is about them. And it is about the quality of life that they can have as a result of these interventions. So Sunita had already highlighted the excellent work and results that HP Plus has achieved in other countries. Next, please. And in Nigeria, just to put that context, that the Health Policy Plus project did not come with new initiatives or try to reinvent the wheel or try to tell Nigeria how we could make our health better. But HP Plus, from our parent body of Palladium, which means the catalysts, actually aligned with existing government policies to catalyze these excellent policies that were already in place into action. And it's as a result of that that we could see the results that we saw. This speaks a lot with regards to sustainability. Because what this means is that, unlike many projects who at the end of their projects would be saying, how do we transition this to government? The work that Health Policy Plus did was integrated and embedded within the health system of already existing government mechanisms and policy. And all we did was to catalyze this, to strengthen capacity, to establish relations, to bring this from book and policy and paper into action so that these real people that we're talking about can actually begin to have the better life that they deserve. So what are our key achievements in Nigeria? As a result of this work, in partnership with the government at the national, sub-national level, and even down to the facility and community level, we supported the government of Nigeria to mobilize additional $80 million for health within a very short period of time. Our work also led to over 282 beneficiaries enrolled into the Basic Healthcare Provision Fund within the first 6 months of its implementation in Osun, Abia, Ebonyi, and FCT, with over 3,000 implementers trained. Now, this is a strong marker for sustainability because these 3,000 people that have been trained have been the ones that have scaled up this training, talking about the snowball effect of scaling up this training to over 30,000 in the whole country and sustaining these efforts in other states, even states where HP Plus did not work. We also provided support for the development of a national policy that will enable HIV/AIDS, which before now has been strongly dependent on donor funding, to mobilize additional $662 million over the next 5 years, which will help us to close gaps, sustain our HIV epidemiological response, and also wean off donor funding in the coming years. Of course, we also provided support to expand health insurance across many states by building capacities, strengthening systems, institutions, and even making sure that this got to the community level where the real impact could be seen. Next. So, I would like to share with you some of our results in enhancing reproductive, maternal, newborn, and child health. Next, please. As a result of the work that we did, in Osun, Abia, Ebonyi, and the FCT, we supported these governments to mobilize additional $58 million for health. If we understand the importance of mobilizing domestic resources and reliance of domestic governments on themselves to drive and determine the direction of their own health actions for the health of their own people. So in addition to raising these resources, we actually strengthen the capacity of these governments to continuously do this action by ensuring that equity funds to enroll poor and vulnerable populations were released in these states, making sure that there was increased budgetary allocation and releases, and even efficient spending of these funds when they are released happened in these states that we supported, but also sustaining the institutional capacity to make sure that this continues to happen even when we're not there anymore. So part of the ways that we did this was by strengthening multi-sectoral partnerships. Before now, people in the health sector would sit and talk to each other. It was like preaching to the choir. But as a result of our intervention, we were able to build the relational capacity of ministries of health, health agencies, to be able to effectively engage outside the health sector where the resources they needed to come from, including ministries of finance, ministries of budget, the parliaments, and all the people that had the wherewithal to draw resources to the health sector. And it was a result of that improved relationship, accountability, and collaboration that we were able to see these results in the states. Of course, I've mentioned the trainers and the scale-up of the trainers and the sustainability effect of this, as these trainers are now the ones scaling up these trainings across the whole country, even 2 years after we closed out this program. Of course, our work also ensured that citizens were actively engaged. So we supported town hall meetings using local CSOs. And as a result of that, their capacities were also strengthened. And these CSOs have now gone ahead to be the one to even put these things in their own work plan and engage communities to ensure that there is citizens' involvement in decisions that concern them, accountability mechanisms, and also citizens' involvement in budget advocacy and making sure that the government is spending enough on health. Of course, we also achieved excellent results in tuberculosis, where we strengthened the national TB programs, as well as the Stop TB partnership. We also achieved a lot of excellent results in working to make sure that there is increased budgetary appropriation, releases, and efficient spending on tuberculosis in Nigeria, which before now, of course, has been highly dependent on donor funding. With regards to HIV/AIDS, HIV/AIDS is one of the areas we worked very lately in. And within a period of 2 years, we've been able to demonstrate and record these excellent successes across 3 key areas. One of them is that we supported budget advocacy at the state level to make sure that resources are allocated. Of course, we know that oftentimes getting appropriations doesn't mean that the money automatically is released. So we provided support across board, engaging across ministries along the public financial management cycle at different levels, including from the office of the governor to the finance ministries, to the budget ministries, to the parliament, and back to the ministries of health and health agencies to make sure that first, they got adequate funds appropriated, these funds were released, and that they actually spend these funds efficiently. And not just spending it efficiently, but that it led to improved health outcomes, especially at the facility and at the community levels. And then, of course, we provided support for integration of health insurance, HIV into health insurance. This is quite innovative because Nigeria is one of the first countries where this is happening. Other countries that have done this, like Vietnam and Cambodia, took over 5 years to be able to successfully integrate HIV into their health insurance. But we were able, with the excellent support of the government of Nigeria at the national level and, of course, Lagos State, to do this within a space of about 18 months. And then, of course, we supported policies because we know that For there to be good policy implementation, there needs to be good policies. So we supported the formation of very important policies, including legal frameworks, operational guidelines, and policies needed to drive this domestic resource mobilization forward. Next. Next, please. Yes. So just reflecting on some of the successes we achieved with regards to HIV/AIDS DRM, domestic resource mobilization. Next, please. As a result of our work, we were able to support the government of Lagos State through the major HIV/AIDS agencies to triple, within a space of 3 years, triple budgetary allocations and releases for HIV/AIDS. In Lagos State, they saw HIV/AIDS allocation and releases increasing by 193% from 2018 to 2021. We also saw that these releases actually led to improved efficiency in the way that HIV funds were spent. So for instance, the agencies now don't depend on donors to procure their HIV test kits and ARTs. We actually saw before now, a lot of the effort had been focused on program management. But now, as a result of this intervention, HIV agencies are now using their own government funding to procure HIV RTKs, mobilize it to the facility, as well as to the community level with improved impact. Of course, one of the major areas that we did some work is in HIV integration into health insurance. For us to be able to get the required political will to do that, we first of all conducted a user fee assessment. Of course, suffice it to mention that evidence generation is one of our key approaches. So we conducted a user fee assessment that demonstrated that people living with HIV/AIDS, despite the fact that HIV/AIDS access is meant to be free at the facility level, were actually incurring catastrophic expenditures as a result of accessing HIV care through both direct and indirect costs, which was impacting on their ability to be able to stay on HIV treatment and also have good quality of lives. Next, please. Using this evidence, we were able to engage across board, including at the national level, state level, community level, across multi-stakeholders, and supported NACA to develop a national blueprint for integration of HIV/AIDS into health insurance. This blueprint has gone on to be implemented in Lagos State, and it provides the direction for the other 35 states and FCT to take when it comes to integrating HIV/AIDS into health insurance. Talk about the importance of policy and good, excellent policies. Next, please. After developing this blueprint, of course, we provided support at the subnational level because we didn't believe in policies that are developed in Abuja and kept in shelves in Abuja. So this policy needed to be implemented down at the state level. And Lagos State rose to the challenge by being the first state to actually go on and not just develop a roadmap for implementing this very important policy, but to actually walk the talk and successfully integrate HIV/AIDS into their health insurance scheme, as a result of which there is improved access to HIV/AIDS care and services for poor and vulnerable populations. So this is the trajectory. As at the time we started providing this support, in 2019, HIV/AIDS, it wasn't being provided through the scheme. By 2020, the blueprint was developed, and by 2021, people started accessing HIV testing services through the health insurance scheme, which is quite novel and not seen in these parts. And by 2022, we now have additional HIV/AIDS services added to the benefit package, including client-initiated testing, including provider-initiated testing, ARV refills, user fees, consultations for HIV care. We estimate that with the current trend and with the sustainability mechanisms that has been part of this approach, that by 2025, over 7 million people in Lagos State will have access to the healthcare services they need, including very important HIV/AIDS services. Next, please. This is just a chart that shows this progress. So we can see what happened from the 2021 that they started up to 2022. You can see the number of facilities that are providing HIV care through the health insurance has gradually increased. And we can also see the number of tests continue to rise. But we didn't just stop there in Lagos State. We also provided support to the Lagos State Health Scheme to expand enrollment of different population groups, including getting approval for payroll deduction for civil servants, engaging the informal sector, including markets. So this is a picture of one of the engagements we supported to market women, getting them to enroll into health insurance so they can have the good health care that they need. Engaging the government to make sure that equity funds that will cover the poor and vulnerable who cannot pay are released. And also engaging and working with this government to make sure that vulnerable populations like people living with HIV/AIDS, orphans and vulnerable children, and key populations are actually singled out and enrolled into the health insurance scheme so that they don't have to pay to access the key services that they need. And I must congratulate the leadership of LASHMA and the Lagos State government for being bold enough to hear the cries of this vulnerable population and hear the cries of the people about what needed to be done and to be able to do that. Now, of course, we also provided support for budget advocacy to make sure that adequate resources are allocated and released to HIV/AIDS. And we can see from the results here the tripling effects, or the triple magic, like we like to call it, of adequate budgetary appropriations made for Lagos. I was in the other room yesterday during the NACA National Council on AIDS, and a lot of the excellent results that were coming out of there were coming out of Lagos. And other states are saying, how can we be like Lagos? How can we be supported to be like Lagos? Demonstrating that we do not have to keep depending on donor funding for our HIV, TB, and malaria response, but that it can actually be done with domestic resources. Next, please. So, of course, we also provided national support to national level policies, like I mentioned earlier, making sure that there is a national domestic resource mobilization strategy, which was the answer to the question that other states were asking, how can we be supported to be like Lagos? So this strategy actually shows the direction of how states, as well as national level, can mobilize adequate resources for HIV/AIDS using domestic resource mobilization. Now, this strategy focuses on different key areas, including public sector mainstreaming, private sector, efficiency, local manufacture of HIV/AIDS, like the DG mentioned earlier, as well as governance of HIV response. I am actually delighted to tell you that this policy is not just a policy today, because many of these strategies in these policies are being implemented as I speak to you today, with Lagos State government actually leading the efforts. The HIV Trust Fund has been established, and it has the mandate to raise $150 million within the next 2 to 3 years for HIV response from the private sector, which before now was only raising 1% for HIV/AIDS control. Of course, multi-sectoral collaboration and partnership has been our hallmark, engaging across boards, including ministries of finance, budgets, parliament, civil society, government, having technical working groups to drive this effort and all that we need to do. Next, please. Our approach, as has been mentioned by many of the earlier speakers, has focused on sustainability. So someone asked me a question yesterday. He said, are there documents and approaches that we want to hand over to the government? And I said no. And he was shocked. He said, you're closing out a project, you don't have anything to hand over to government. I said no, because our approach has been sustainability from day one. All our efforts have been integrated into government existing systems and mechanisms. So everything that we could be handing over today is already imbibed in the way that these organizations work, in the way that government is doing this work as a result of our support. So it's been integrated, sorry, go back a bit, policies developed, multi-level, cutting across from national level down to the facility and to the community level. Perhaps in my decades of working in the development sector, this is the first time I'm seeing this kind of holistic approach that involves providing support to national governments, parliaments, other sectors, down to state level, down to building the local government. Someone mentioned something about importance of local government. Building important local government structures, local government committees, health authorities, down to the facility level, strengthening capacity, both technical, institutional, as well as relational, of the health sector to be able to engage outside the health sector, and even down to community level, engaging with ward development committees, building capacity of CSOs, and building capacity of communities to demand accountability from their implementers. So it was quite holistic, it was quite unique, and that is why the results we speak about today are here. Next, please. Of course, capacity development. So our efforts cut across capacity development. That is why, needless to say, we have nothing to hand over, because we've entrenched capacity development multi-level across all the work that we have done. Next, please. Governance was also very important, strengthening governance systems at the different levels and making sure that there is citizens' accountability as well as accountability from the government to the people. Next, please. Of course, a very important aspect of our work has been self-reliance, which we've integrated into our work from the beginning, including financing self-reliance. So making sure that there was adequate budgetary provisions, that there were adequate laws and legal framework that provided the financing for these interventions so that we don't need to talk about, how to scale it up or how to sustain it, to operationalizing policy documents. So most of these policy documents were there, they were not being implemented. And then we provided support to government to get them to become implemented, including the Basic Healthcare Provision Fund, primary healthcare under one roof, health insurance decentralization, and we've seen the snowball effect that this has had in the country, as well as strengthening capacity, because it's human beings in agencies and all of that that would implement these policies. Next, please. So what are some of the lessons we've learned? We've learned that it is very important, perhaps for other programs and partners that are coming to Nigeria, it is very important to follow local leadership and align with government policies, because it is only the government and people of Nigeria that understand best and the most about what the problems are and what the solutions need to be. We, of course, used evidence and multi-sectoral action, knowing that action that will lead to change needs to come from outside the health sector, otherwise we'll just be preaching to the choir. And then, of course, being conversant with political economy and applying it to the way that we did our work. And then, of course, perhaps to say that being able to do this work required taking out time to build trust, commitment, relationships, and capacity that is needed to sustain these actions. Next, please. Next, please. At this point, permit me to just share some witnesses from the field, please.
Nothing was working. There was no coordination, the governance was poor, and we were not able to achieve what the positive health indicator should be. But between that time and now, things have begun to change with the intervention of HP+. It's not enough to say the law has been passed. But has it come to reality? Has it been operationalized? That was a challenge. And if not for the intervention of the HP+, we might still be flagging on that.
Many thanks to HP+. I used to say, anywhere I go, that HP+, the heartbeat of BACPF in Osun State.
What I would say, conclusively, is that we have learned self-reliance through the work of HP+.
Testimonials, and then can we go to the next slide, please? Yes, so these are also some testimonials from OICs, including an OIC that actually, next please, an OIC that actually said that she has noticed the increased enthusiasm to work among the staff in this primary healthcare facility, which before now was not getting any funding to repair leaking roofs, to buy things like stethoscopes, FIG, and all of that. The situation was so bad. But with this intervention, they were able to access funds for the first time, and they were able to repair leaking roofs, buy couches where pregnant women could give birth, buy basic drugs and medicines, and the effect in the community was amazing. We actually saw communities mobilize to make sure that power was restored to their facility, because they were seeing things they hadn't seen for the first time. Of course, we saw the testimony from one of the people in the facilities and all of that, to bring electricity to the facilities, to buy hospital beds, to do a lot. So if this, imagine if we could close our eyes and imagine if this could happen in every single primary healthcare facility in Nigeria, what Nigeria would turn out to be. I leave the dream for all of us to contemplate. Next, please. I wouldn't stop without acknowledging the excellent partnership that made all of this possible. First of all, I want to appreciate USAID for giving us this wonderful opportunity to be able to provide this support to the federal government of Nigeria. They enabled us. They gave us a flexible working environment. They listened to our ideas. They listened to us each time we came back to say, this is what Nigeria really needs. And I think that that is actually not very common. So please, let's appreciate USAID for that. And then, of course, PEPFAR, government of Nigeria, who led. When we're talking about localization and locally led policies, government of Nigeria demonstrated excellent leadership across all levels, and all we needed to do was to catalyze this action. So we must appreciate the government of Nigeria, the different partners at the different levels, health insurance scheme, primary healthcare agency at the national and subnational level, including development partners, special recognition to the Lagos State government and the governments of Osun State, Abia State, FCT and Ebonyi states for the excellent partnership that they gave us for us to be able to achieve this, as well as other implementing partners that supported this. So I would like to enjoin all of us to sit back and sit tight, because for the rest of today, we'll be listening to these key stakeholders that implemented these policies, both government partners as well as other people that were involved, share their experiences about their thoughts about how this great success was achieved, the lessons that we can take into the future, into making sure that we all have the Nigeria that we all dream about. Thank you so much for listening to me.
When she said that, I guess you would be expecting to see just what we'll call a tip of the iceberg. Ladies and gentlemen, you can agree with me that she has displayed that to us. Put your hands together for the Country Director, HP Plus, Dr. Francis Elika. Thank you very much, Ma, and your team. Very important, because there were a lot of men and women behind the mask. I can see Ure. I can see the rest of them. Sabina and the rest of the team members. Thank you very much for being amazing. We do appreciate you greatly for your great works. Please put your hands together for the leader and the team as well. Thank you. We do appreciate you. Thank you. And then, like the team lead and country director have announced to you, sit back, relax. It still promises to be a very good day. At this point, I would like to introduce the next item on the program, which is the award presentation. All the beautiful work that the HP Plus have done in Nigeria for the past 7 years have not been made possible just by mere talks and a single effort. There are some individuals who have contributed immensely towards the success that we celebrate today at the end of project event. And these individuals, we deem it necessary to recognize them and appreciate them so they keep doing more for our dear country, Nigeria. And so at this point, I would like to invite the country director to kindly come forward. So we handle this session. I know she has gone to get the other dignitaries who are very much around, but while she is coming, I would like to bring on to stand with me. I don't want to stand here alone at this point. Dr. Chidumga Ohazulike, a very young doctor who is doing so amazing in the area of health project financing. Dr. Chidumga, thank you very much for being amazing. Please come forward. Please send message to the DG Naka to join us at this point. Yes. Do I have your permission to invite the awardees now? Oh, what an honor. Okay, I have been graciously granted the honor to invite the awardees. First in my list, and a representative is right here, is Professor Nasir Sambo. He was with us, but due to exigencies of his office, he had to leave to attend to other national assignments that he has. We have a representative of the Executive Secretary, CEO, National Health Insurance Scheme, Dr. Nnenna Kalu. Dr. Nnenna Kalu is right here. I saw her right here. Dr. Nnenna Kalu. Okay, she will be joining us. We have a representative of the Executive Director, CEO, National Primary Health Care Development Agency, Dr. Faiza Shoaib. She's here right now. Please, she will be joining us. We have the Director General, National Agency for Control of AIDS, Dr. Gambo Aliyu. He's one of the awardees. He is right there. Okay, he'll be joining us soon. Please send a message to him. Thank you. And then, of course, right here with us is Dr. Monsurat Adeleke, the CEO, Lagos State AIDS Control Agency. Please put your hands together for her as she comes forward to receive her award. This is a recognition of your outstanding dedication to advancing sustainable HIV and AIDS financing in Nigeria. Congratulations, ma. We also have Dr. Emmanuel Zamba. Emmanuel, I beg your pardon. Dr. Emanuela Zamba, General Manager, Lagos State Health Management Agency. Okay. Congratulations, ma. This is in recognition of your outstanding dedication to advancing healthcare financing reforms in Nigeria. Congratulations, ma. Dr. Emanuela Zamba. Thank you. And our greetings to Lagos State. We have right here another awardee, Dr. Adeni Ogini, CEO, Ocean Health Insurance Agency. I was meant to understand that he is joining us via Zoom. Okay, do we have a representative to kindly pick his award on his behalf, please? Thank you very much. Congratulations. All right, the representative of the Executive Director and Chief Executive Officer, National Primary Health Care Development Agency, Dr. Faiza Shoaib, is right here, and she is none other but Dr. Nneka Onwu. Please receive the award on behalf of the ED. Thank you very much, and send our regards to him. We are anticipating. Thank you very much. Congratulations, Ma. Good. We look forward to receiving Okay, Dr. Jibril Mohammed would be receiving the award on behalf of the Executive Secretary and CEO, National Health Insurance Scheme. Dr. Jibril, thank you very much for coming. Congratulations. We are expecting the DG NACA to join us at this minute, and I can see the protocol officer going to bring him. Okay, receiving on his behalf. Okay, beautiful. Mrs. Josephine Carlo, thank you very much, ma. It's quite an eventful day for you. Thank you. Congratulations to all the awardees, and thank you, HP Plus, for saying thanks to whom that is deserving of it. Okay, a little amendment here. Dr. Sunita Sharma has an award that she would like to present. Please, let's listen to her.
We believe that we catalyze action, we believe in country leadership, capacity strengthening, and all of that. And HP Plus is one of the highly successful projects for Palladium. And I'm here to really, you all have heard Francis and the team has done excellent job. So Palladium would like to award this to Francis and her team. So just to thank her for excellent leadership.
Thank you very much, Dr. Sharma. Our sincere appreciation goes to you. And of course, thanks to the team for doing an amazing job. Congratulations.
We would want to have this panel discussion titled Advancing UHC Reforms Through Domestic Resource Mobilization Mechanisms. And this will be highlighting the key UHC platforms that we supported, including the Basic Healthcare Provision Fund, State Health Insurance implementation, as well as primary healthcare under one roof implementation. To speak at this panel are highly distinguished members of key government institutions, as well as civil society. And we're quite privileged to have them join us today. I would like to first start by inviting, in no particular order, Dr. Obe Orishewemi. He is from the National Primary Healthcare Agency. Dr. Obe is a Chief Medical Officer and Program Lead for the Basic Healthcare Provision Fund at the National Primary Healthcare Agency, responsible for the day-to-day implementation of the MPHCDA component of Nigeria's Basic Healthcare Provision Fund, an innovative mechanism backed by an act of parliament which aims at catalyzing Nigeria's progress towards UHC. For many of us that have provided support to National Primary Healthcare Agency on BHCPF, you cannot talk about BHCPF without talking about meeting or speaking to or talking about or hearing about Dr. Obe. So it's a pleasure to have him join us today. Please let's welcome him. So prior to this current schedule, Dr. Obe has worked in various capacities within the MPHCDA, providing technical expertise in health system strengthening, health financing, including leading the development of innovative national strategies, concepts, and guidelines. He has also served as the divisional head for head financing at the MPHCDA and supported 2 executive CEOs as technical advisors. So we can see that we have a very important person with us today. I would like to also invite Dr. Nenaya Kalu Ume. She's the technical assistant to the executive secretary and CEO of the National Health Insurance Scheme in Nigeria. There is nowhere that you see Professor Sambo and you don't see Dr. Nena. She's also the program manager of the NHIS Leadership Development Program and a deputy director, deputy general manager by rank. She holds a first degree in medicine and surgery, as well as master's degree in public health and business administration. She was at various times the NHIS focal person for the Presidential Summit on Universal Health Coverage, the Basic Healthcare Provision Fund, and the SDGs. She's an alumnus of the World Bank flagship course on sustainable healthcare financing and has attended several related local and foreign trainings. She's passionate about the welfare of women and children, as well as mentoring the next generation of leaders. Please let's welcome Dr. Nena to this podium. We are also very much privileged today to have Dr. Mohammed Ahmed Danfolani. Dr. Danfolani, as we fondly call him, he's the CEO of Fct Health Insurance. And we're so delighted to have him today. He's been with us since morning, was one of the first people to get here. That is how committed Dr. Danfolani is in everything that he does. He has 28 years of experience as a physician, global health forerunner, administrator, and bridge builder. He worked in partnership over the years with non-governmental agencies like WHO, USAID, HP+, bilateral, multilateral development organizations, as well as civil society. He worked as a senior staff within Fct Administration, as well meritorious record of service as medical director, both in Kuje and Kubwa General Hospitals. He reorganized, overhauled the existing structures, and established new parameters for good governance, operational delivery within 6 years at the Fct Health Insurance Scheme. He was deployed to Fct Health Insurance Scheme to serve as the director CEO of the scheme, and since then he's been doing an excellent job. Let's welcome him once more. Last but not the least, we have a representative of the people that this is all about. Please kindly permit me to invite Anu Rotimi to join this distinguished panelists. Anu Rotimi, founder and executive director of Center for Accountability and Inclusive Development, is a system strengthening and accountability expert. As a social and development activist, Anu has been a committed advocate with over 2 decades experience in promoting sustainable and inclusive growth for human, social, economic, and environmental development towards building sound and responsive systems in Africa. She's widely renowned for her coalition and partnership building, accountability, and system strengthening in the health sector. She's a WHO certified health financing expert, 2017 winner of the 120 under 40, the New Generation Family Planning Leaders, member of the FMOH Health Financing Technical Working Group, member of the Ministerial Committee for Spirit Drink Regulation, co-convener of the Human Capital Development Network, and Fct Accountability Mechanism, amongst others. In this space, you cannot talk about CSO without mentioning Anu. She has to be there. So please join me to welcome this multi-talented lady to this panel. So now we'd like to move on to the panel. So in the course of today, we've come to learn about all the extensive work and progress that has been made in Nigeria, providing support to key government agencies like the National Health Insurance Scheme, the National Primary Healthcare Agency, Federal Ministry of Health, civil society partners, to advance already existing UHC mechanisms like BHCPF, state health insurance, primary healthcare under one roof, from policy level to actual implementation level, which led to the results that we saw. So right now, we want to directly hear from these stakeholders to share their experiences with us about what has been the enablers for some of the progress that we've made in the past couple of years. What were the challenges they encountered, how they overcame them, and then perhaps questions for the future. Where do we go from here? So I would like to start by asking Dr. Nena of NHIS. NHIS has this ambitious goal of ensuring universal health coverage for all Nigerians. The journey has not been easy. It could be described as tumultuous, but much progress has been made lately, like we could see from the earlier presentations, in expanding health insurance and BHCPF at the subnational level. Could you please share with us what enabled this rapid progress within the past years? What challenges were encountered on your way? And what support did you find beneficial? Over to you, Doctor.
Thank you very much, Francis. It's a privilege to be here. In terms of universal health coverage, at NHIS, we pride ourselves as being the leaders when it comes to focusing on universal health coverage. Our focus is making sure that every Nigerian has financial access to quality health care, with financial risk protection. Now, over the years, we've made a lot of progress, if you listen to the Executive Secretary's speech, especially in the last 2.5 years since he has been at the helm of affairs. He mentioned a couple of things we have done, improving stability, making sure that we have a 10-year strategic plan. We developed a medicine supply initiative, and so on and so forth. With respect to the Basic Healthcare Provision Fund, We've also made a lot of progress in working to make sure that the most vulnerable among us also have access to care. I used to be one of the focal persons for the BHCPF, and we work closely with HP Plus and other agencies and stakeholders to make sure that we went to the grassroots, to make sure that the coverage actually got to the people. And some of the enabling factors, I can tell you, we can summarize them into 3. We talk about leadership, we talk about commitment, and also strong partnerships. In terms of leadership, and I'm not just talking about leadership at the federal level, there was leadership at the state level, down to the local government level, down to the facilities, even the focal persons. A lot of leadership was exemplified. A kind of leadership that would say we are leaving nobody behind no matter what. Every last man or woman or child standing had to get this health insurance coverage or benefit from the BHCPF. The kind of leadership that would say no matter what it took, we are going to go all the way to the end. So that leadership was there. That commitment was there because we had to sacrifice our time, we had to sacrifice finances, efforts. We went around the country mobilizing, sensitizing, training, and so on. So the commitment was also there. It was an enabling factor. And then the strong partnerships across the various organizations. It didn't matter whether we were federal or state, whether we were NPACD or NHIS, whether we were private sector or public sector. Everybody worked together towards the same goal, which is universal health coverage. So there was that camaraderie, there was that partnership, and even when maybe somebody dropped the ball, somebody was always there to pick up the slack. And those are the enablers that have made us come as far as we have today. And we look forward to that continuing partnership that HP Plus help us to catalyze and help us to make a lot of progress. Were there challenges? Yes, a lot of challenges. For one thing, health insurance wasn't mandatory. Health insurance is not mandatory. Secondly, we were trying something totally novel. Like was said earlier, we had to develop a lot of the manuals, a lot of the tools, a lot of the training materials we had to use, and even trying to get people to understand the concepts. It wasn't easy, but we were able to do that. So those are part of the challenges that we had. Finance is another issue. Having the money to fund, adequate funds to fund all the activities, and making sure that the funds for the BHCPF, going to the gateways and down to the states are actually adequate, are actually on time, because I can speak for the health insurance gateway. You're talking about health insurance, you need to have adequate funds. You need to make sure that these funds are regular so that you can pay the subscription or the premium for the people. And you need to make sure that these funds are actually growing so that you can cover more people. So funding is a major factor as well. So legislation, funding, and capacity building, and so on and so forth. Those were major issues. I talked about moving forward. Okay, how did we overcome all that? I think by working together, a lot of advocacy, developing strategies, there are a lot of meetings, and so on and so forth. So we were able to deal with quite a number of those challenges. And moving forward, we have a lot of hope. We have hope that the National Health Insurance Authority Bill, which is still pending, will be signed into law. That will help make health insurance mandatory. And will also mobilize some more domestic resources for the health sector and for health insurance specifically. We're hoping that the partnership with HP Plus and other agencies, donor agencies, will also continue and can be scaled up. We are hoping that the partnership with our sister agency, NPACD, and the CSOs, the state-level agencies, state health insurance agencies, would also continue, just like we have formed this platform, Health Insurance Under One Roof, to coordinate all our activities. And so moving forward, there's a lot of hope. There's a lot of things going on in the background, and I'm sure as we go on, we'll hear more about it. Thank you.
Thank you very much, Dr. Nena, for that excellent submission. Just hold on to it. For that excellent submission. She has highlighted a number of things. She highlighted the political commitment and leadership that was there, the commitment of the agency staff, as well as the partnerships that they were able to build with partners, like HP Plus and all of that. But perhaps she also mentioned something very important, the relational technical as well as organizational capacity strengthening that the NHIS was able to enjoy as a result of the partnership with HP+, including in developing the manuals, in trainings, scaling down these trainings down to facility level, and all those kind of support that was necessary to be able to take this policy from a paper or a policy document into actual implementation down to the facility level. So now I would like to move down to the facility level, because she said something. She said some of the challenges were, you know, finances, technical capacity at the state level to implement this and all of that. And we have here with us Dr. Dan Fulani, who is the CEO of Fct Health Insurance Scheme. Part of the things that we heard in the morning was that HP Plus supported states to meet the criteria for accessing the Basic Healthcare Provision Fund. And part of that support was in strengthening their health insurance scheme, building capacity, generating evidence, and things like that. So we'd like to hear directly from Dr. Fulani. Dan Fulani, could you share with us? FCT is one of the states that have advanced the most when it comes to implementing state health insurance, including expansion of health insurance enrollment to the formal and the informal sector, and even covering vulnerable populations through Equity Fund. Could you share with us, you know, what support you found useful in being able to achieve this? What were the enablers? And then maybe perhaps some challenges and how you overcame them.
Yeah, thank you very much, Francis. FCT Health Insurance, I think, is one of the oldest state social health insurance schemes, close to 15 years now. And over that period, there has been not a very significant improvement in terms of enrollment. And we are stuck only at the level of formal sector. In this regard, I will commend the FCT administration that allows direct deduction from staff salary to enable us start this aspect of health insurance. But strictly speaking, there has been no significant progress. As soon as the HP Plus as a partner joins FCT, a lot of things changes. Number one, there was this special organization assessment they did. In fact, while they are doing that, I was wondering, are they coming to audit us or what? They want to see every aspect of the processings we do at the health insurance. They want to know who does what. They want to know what are the gaps in terms of human resource. And by the time they finished this, I had to change my organogram. And because of the HP Plus, the current organogram I'm using now is based on their institutional assessment, looking at what is there, looking at what is not there. Not only that, all the processing of our activities, including development of documents, as I sit before you today, I can confidently tell you that all the documents we develop, operational guideline, standard treatment guideline, benefit package, were entirely the support of HP Plus. They took us to a place, we had a retreat, and these documents were developed and is being used today. Again, the area council aspect of the formal sector, which is different from the FCT, you know, they were completely out of the scheme. But with the level of advocacy that we had in partner with AP Plus, already all the 6 area councils have been brought on board. Within less than 6 months of this partnership, we're able to bring the area council on board as partner. Again, the benefit package that we're using, they had a very huge impact in terms of what is good, what is not, the development. We also had a retreat completely sponsored by HP Plus. They also engaged a consultant that carried out an actuarial study of our benefit package and all the services that we're rendering. And we're able to arrive at a sustainable projection for the activities of the Fct Health Insurance. From the actuarial study, again, we're able to determine the premium for our informal sector. As I speak with you, the bill of the Fct Health Insurance is still not yet signed by Mr. President. But from the beginning of development of this bill, through advocacy to the National Assembly, through advocacy to the FCTA leadership, advocacy to rural communities, traditional rulers, were able to push that bill for assent by Mr. President, but we are still waiting for that. So, the enabler that made Fct Health Insurance move rapidly to where we are today is, to the glory of God, the major support we got from HP+. And that has led us today to enroll all the formal sector, that's the FCTA staff and the area council. And we're also already in the informal sector. A lot of companies are already registered with Fct Health Insurance. Individuals walk into our offices to come and register. This is greatly due to the support we have from them. Now, challenges. It's not easy to market health insurance anywhere in the world, not to talk of Nigeria. And simply because there is a lot of ignorance to the importance of what health insurance is. You go to somebody who is not sick, and you are asking the person to come and pay in anticipation of sickness. It is not easy. And I'm sure everybody experiences that. You go to a religious group, and the first thing they look at you is that, why are you praying for them? That they rebuke it, this is not their portion. So it is very, very difficult to market health insurance. But because of the strategy we have adopted, because of the planning, the informal sector approach to enrollment of individuals, this has helped us a lot. And that has been what has seen us to the people trooping in to come and register in our agency. So ignorance is a very big problem. And that also leads to the bill. If there is no law in this country that makes health insurance enrollment compulsory, we are still going to be very, very far away from UHC. And that's why every law, all share, most of their law made it mandatory. And until this law are compulsorily enforced, enrollment into health insurance might still be a challenge. So that law thing, to be in the document and to be enforced, we still have to really address it. Then the political will or political buy-in, believe me, I want to believe that it is still not where it should be in this country. The political buy-in, if you ask me, is one of the most important factors that will ensure that universal health coverage in Nigeria becomes successful. All of these things we are saying, if the political leadership, either at the subnational level or at the national level or at the area council level, where we saw a lot of challenges, the area council leadership, they pose a lot of challenges until we're able to surmount it. So political leadership is a very big challenge that we summon. And then looking forward, I hope to see an insurance landscape where coverage is extended to everybody in the country, all residents of this country, especially the poor and vulnerable who ordinarily cannot on their own come onto this program.
Spoken about the informal sector strategy that you developed with HP Plus support and how this is helping you to get the informal sector. Perhaps also the willingness to pay study that we supported that helped you to identify that most people, even though they are willing to pay, will rather pay installmentally because they don't have all the money at the moment. Yes. So maybe if you could reflect a little bit on how helpful that has been, and then you're one of the states that have been able to access your equity fund, some money to enroll some poor and vulnerable. So could you also share that experience with us as well? Okay, thank you very much. Yeah, I cannot go through all that HP Plus have done for us, so much. We did the willingness to pay and ability to pay studies, and that throws a lot of insight on how to adjust our business, our premium and premium payment. And with a lot of partnering and discussions, we arrived at, rather than impose some amount of, because no matter how small the amount of money is, you still find out that some people cannot pay. Even if it is 1 naira, some people will still cannot pay. So we now adopted an approach where we can stratify this payment, and in doing that, a lot of enrollees were being engaged.
And when we presented the outcome of this initial findings to our leadership, they released some funds for us, apart from the basic care provision fund, that we're able to enroll people onto this program. So that has helped a lot. But I'm also heard here that even when you want to enroll people with free of charge, you still have to do your great own work. You still have to sensitize people. And that is the greatest challenge we're having with the basic care provision fund now. You realize that when a lot of people are enrolled free of charge, utilization in most states where this program is going on now, if you see anywhere that is more than 8%, that is service utilization, then you are very happy. In some facilities, 0. So we also engage in a lot of community sensitization through the community gateways to encourage people to use this service. So that's how we are able to solve that.
Thank you so much for sharing those excellent insights, Dr. Danfulani. The partnerships that you found the most useful, especially with overcoming issues that have to do with political commitment, engaging the area councils, engaging the ward development committees, engaging the local government health authorities and all of that to make sure that we move things forward. I would like to, at this moment, move to MPHCDA. Now, when we talk about the work that we do, we say that we address both the demand and the supply side. And why this is important is because the demand side is removing the barriers that are preventing our people from accessing the health care that they need. But what about we remove these financial barriers to people accessing care? And they get to the primary health care center, which is closest to them, and they can't find quality health care services. What happens then? All our efforts would have been futile. So that is why our approach is so holistic, that we address both the demand side as well as the supply side. And we provided support to the National Primary Healthcare Agency. But I wouldn't want to talk about that myself. I would actually at this point want to invite Dr. Obey. Dr. Obey, the MPHCDA, has successfully advanced key policies, including primary healthcare under one roof, basic healthcare provision fund implementation, from the national level down to the facility and even the community level. Could you share with us your experience and lessons in moving these vital policies forward? What supports and partnerships did you find useful in overcoming the challenges that were prevailing at the moment?
Thank you very much, and good afternoon, everyone. We appreciate the opportunity to be here, from the invitation by HP Plus to speak, and also the Executive Director MPHCDA for personally asking us to make sure we're present. I think I'll focus most of my response around the BACPF that I lead and I'm knowledgeable about. Primary Healthcare One Roof is one program that the MPHCDA would boast of that has really made a difference in improving, despite how suboptimal it still is, the delivery of primary healthcare services across the country. And this has really happened mainly because of our partnership support right from the beginning to the time HP Plus came on board and took up most of it, especially at the state levels where they were working, to see that it was actually implemented and functional. And most of us are quite aware of the outcomes of those things, particularly in terms of helping to expand the fiscal space and program management capacity of the state primary care boards and helping them to actually move their primary care systems forward. Why this is still at various implementation across many states, I think the impact of support, particularly in the state HP Plus was working, has made a bit of a difference. For the Basic Care Provision Fund, within a short time compared to other programs both run by government and partners, from the MPHCD Gateway side, we have had a tremendous scale up, and that comes with its own lots of teething problems, which this is not really the forum to go into. But as of date, we have close on 6,000 plus primary care centers across the country actually now receiving the direct facility financing to help them meet their operational need. And that's making a tremendous difference at that level, just changing the narrative, making sure their medicines are valuable, making sure that the health workers come to work, and even improving the availability of skilled bed attendants at that level. So it has made a lot of difference. And it is that difference that is now making us observe the challenges that the NHIS has just highlighted about the need to actually get people to use services, because sometimes even though they know that I can get services free, they are still, the old knowledge of the fact that they could not really access services and had to pay still causes some kind of hesitancy that the NHIS is trying to address. But principally, I would like to look at it from a different, make my submission from a different approach, and that is looking first at the challenges. So we all know the classic challenges in our health system, so that's not for me to go into. I want to look at the challenges of partnership and working collectively to achieve a goal. So one of the very key challenges that was a setback at the start of basic provision was that of consensus building. It might sound so basic, but it was a very big challenge, both between the government implementers, both with the government implementers and our partners, between partners. It was really, really a challenge at the beginning, and was sort of, and it was centered around things like implementation strategies, roles, responsibilities, things that challenge core mandates of organizations. And that was almost like making things look very impossible. But I think somewhere along the line, and I don't know what, and I think maybe we need to have a tea conversation with some of the HP Plus leadership now and previously about what snapped. But suddenly, HP Plus woke up and decided to focus, instead of the process and ownership and who wins and who loses, to what is the goal? What are we all trying to achieve here? And the idea was we needed the Basic Care Provision Fund to start, because there was some funding available from GFF through the World Bank to start off some states with the pilot states, and those pilot states were part of the states that HP Plus was supporting. So with that new mentality, we shifted to what really needs to be done. And the first, that people need to know what they need to do to implement the Basic Provision Fund. And that was where they now stepped up their role in terms of developing the manual. So initially, we were all running around in circles, but I had a conversation one day with the management, and then things just started to change. So focusing on the goal, focusing on the core objective in terms of when we work with partners is a very big lesson which we could take away from the HP Plus project. So instead of worrying too much about who is responsible, whose mandate this is, what do we want to achieve, and what can we collectively do to achieve that end? And the manual was the kickstart of everything. And I must say that the capacity they provided for that was exemplary, because we came up with a new style of training that was not commonly used for public health within the Nigerian space. I keep asking my capacity video officer every time I'm writing something, what is the name of that training method that we used to use? I still don't know it myself. I keep forgetting it. Whether it's didactic or something like that, where we use a lot, instead of relying too much on PowerPoint, we have them to actively, like an adult learning kind of style thing that was done. So I did not only just help in developing the manual. I think what was most critical was the initial trainings that were done for national teams, particularly at the MPACD, on how to conduct training, on how to ensure that people are learning when you are training them. And that was what really helped us to be able to facilitate and quickly cascade across all states of the country the training for the Basic Care Provision Fund, and get it going. Because once people were trained and they were ready with that support they were providing in their focal states around ensuring the State Primary Care Board was positioned to work, the accounts were opened, the WDCs were formed, and those system strengthening things which they did, particularly Ebonyi, Osun, FCT, and Abia, was what enabled those states to be ready to receive their first tranche of funding. They were also the first states to be trained, and they were the learning states, because when we trained, after training the first state, which was, I think, Osun, we virtually went back to rewrite half the manual again before we moved on to the other states. So those were very important steps where they really played a key role in finding that synergy with government and allowing government to take the lead. And because of today, something else was mentioned that was equally important, was aligning clearly with government policies. One of the challenges that we commonly have with partners that often sometimes what they want to do in the country, the budgets they want to spend, and where they want to spend those budgets are largely already determined before they actually start engaging with those who will implement the programs. So it causes a lot of friction in trying to readjust and realign budgets and objectives and outcomes and expectations. But somehow, I think maybe it was the Palladium model, there was a lot of flexibility in the work of HP Plus, and that allowed us to really focus on what needed to be done. So at the state level, they were able to align resources to exactly those steps that government had determined that these were the steps that must be taken for BACPF to take off. So it's not a function anymore of, no, we think this method, we have learned from Cambodia and Vietnam that this method is the best. It was like, this is what government has said we should do. We have discussed it, we have worked out the details, it's workable, let's get it done. And I think that drove a lot of things to get us quickly to the end point. So money was being committed and money was aligned with the priority of government and to the steps and to the implementation pathways that government wanted it to be. And that made a lot of difference. And also in terms of the working mechanism, I think it was very helpful that they worked almost like they had officers that were sort of like dedicated to certain tasks. So if I wanted anything to do with the trainings, the manual, I knew who to call. I didn't have to call the head of HP Plus to find out we have this problem. My officers knew who to call, and there was that seamless communication, and decision making was faster, was seamless, and I think that too was very important, because sometimes a lot of partners, when we communicate, they're like, oh, you need to go write a letter, and the ED needs to sign. I mean, even getting to get the ED to even sit down and say, sir, you have to listen to this, and it's a lot of effort because it's so busy. So when you talk to a partner and say, don't worry, write us a letter, let ED sign and send it to us. But with that arrangement we had this because I could pick up the phone, I could call, and they'll say, okay, I'll tell this person to call this person. And before the close of work, we have alignment, we have agreement, and we're moving on to next, and the paperwork comes up much later. So I really want to just commend them really for that and for the capacity, residual capacity left behind after we did the work initially on the BSCP, particularly around the manual development and training. So when it comes to training now, I don't even blink. I have officers that can say, we are going to train people prepared to train, and I'm sure that will go very, very well. In terms of expectations of the future, I think for the MPACD, it's hard for us to say expectations of the future without, we look at it in a very holistic and integrated manner. So what's the future for primary healthcare? And I think the Honorable Minister of Health, Dr. Sagir Nagiri, working through the MPACD led by Dr. Feza Shariba, clearly articulated at the Just Concluded Primary Care Summit what the future of primary care should be. It's to develop a resilient system that can take us to UHC and achieving the SDGs. And to do that, with the 4-point agenda has been also been allocated and circulated amongst most of our partners, and we have a lot of partners that are bought into that and working with it. But central to achieving the 4-point agenda, it's really the aspect of the enablers, and key amongst that, the two, governance, which the primary healthcare one has been helping to address in a systemic manner, but health financing, which cannot be underplayed. And the BACPF is already laying that foundation for the health financing, because we look at it for only 2 prongs that will make it happen. One, facilities must have operational funds that is independent of that difficult budgetary cycle. And the BACPF is already creating the model for that, despite the difficulties it has, because we have had to scale up, because the law. So initially, the Honorable Minister said we should pilot in some states, which were the HP Plus states. But they came up and said, look, this is a law. The law does not say pilot. Everybody, every Nigerian should assess. And so we have to scale up fast, and we are learning as we are scaling up and improving things as we go. But the BSPF is creating that model whereby facilities on the front line can receive money based on a plan that they have created by themselves with their communities and target those monies at their peculiar needs, right? And the second part of it, which is really what the NHIS is helping us do, is that to make this happen, and this is where we need our partners to, in a singular voice, really join government in advocating and pushing both government itself and other partners to come in, is that of the mandatory social health insurance scheme. We simply just can't cross that hurdle of our health financing needs in Nigeria without getting that right. So that has to happen, and has to happen quickly. But more important, but also coming out of that in terms of looking forward to the future, is really tapping into domestic resource mobilization, where we're now looking really at the private sector with a critical lens. We have been discussing at them, both from the level of the Honorable Minister to program officers that work in the organized private sector, to see how the private sector can support domestic resource mobilization for health. So that it's not just the partners bringing in the funding all the time, but also saying, this is how much we've raised domestically, this is where we are putting the money, and this is where the partners have to put the money. So I will end by saying that we really need to take these lessons from HP Plus for other partners here, and as you continue to cascade the lessons learned, is that partners must find a way to address the priorities of the nation. Sometimes partners have these roadblocks, oh, we can't invest in this, we can't invest in that. But all the investments you make must translate to only one thing, that somebody in a rural setting somewhere can go to a primary healthcare center, for 70% of the burden of disease Nigerians suffer and get care at a cost that is not catastrophic and a care that's of good quality. If your funding is not contributing to make that happen, you are wasting resources, and you are wasting resources that you have raised on behalf of the government of Nigeria. For the BACPF and in the startup process, HP Plus committed for funding to those things that will make that happen. And that is why I always have a soft spot for them. Even when I'm upset with them and they talk, I listen, right? Because they really made that happen. And so we need partners to really, really try. Because, for instance, why I'm emphasizing this, one of the issues that we have in terms of the future for primary care reimagining, that you always hear the MPs talking about now, is the issues of revitalizing primary care centered around the human resource for health. It's a major problem. So if partners come with all the funding, and maybe as HP Plus evolves to another program, or Palladium comes up with another program, funding to train, build capacity and all that, and you're not finding a systemic way to work with the states to help improve the availability with all the brain drain we have going on now of human resource at the grassroots level in the primary care centers, of creating an environment to enable them to deliver quality care, we still will not get to the promised land. And I think that is one other thing we need to take away from this and really look forward to working on. Thank you very much.
Thank you so much, Dr. Ogbe. Please let's appreciate him for your passion, as well as your vivid description of the process. When you were talking, you took me back to those days when we were working on these documents and everything. Dr. Ogbe has highlighted some very important lessons that we need to take forward, like in his words, for other partners and for other interventions that are going on. Aligning with government priorities is very important. But he also raised a very important issue, responsiveness. In the morning, I earlier thanked USAID for enabling us to be responsive to the needs of the Nigerian government, because it's not easy to always go back and say we want to change our mechanisms. We want to do this because we think that this fits better to the needs of the government. And we were able to respond. And we're really happy to hear, from Dr. Ogbe today that this was extremely helpful. I don't think there's any better description of the word localization and local ownership and leadership than what Dr. Ogbe just described. And I'm really happy to learn that they found the HP Plus experience very helpful in that. And that, of course, is why, we could see the results down to the facility level, with the HP Plus states being the first to implement and assess funds at the facility level for BACPF implementation. Thank you so much once more, Dr. Ogbe, for that. Now, we often say that everything we do is for the people. And right here with us, we have somebody who is synonymous with CSO in Nigeria. I'm sure we all know her, Anu Rotimi. So moving on very quickly to you, Anu, to kind of reflect on the impact that all this work that implementers, all the English we've been speaking, if I may use the Nigerian word, means for communities, and how this has helped to impact on the life of that woman that Dr. Ogbe just spoke about right now. Citizens' participation and social accountability is a critical part of ensuring the success of health reforms. So could you please share with us the role that CSOs have played in ensuring citizens' voice and accountability in the implementation of BACPF and the lessons learned, and maybe perhaps some of the support you were able to enjoy when you were doing that?
All right, thank you so much, Francis, and thank you so much, HP Plus, for having me. And I must actually commend HP Plus and USAID for responding to the need of Nigerians, because Basic Care Provision Fund is actually an intervention that speaks and addresses and provides care for Nigerians. And we can say the success of Basic Care Provision Fund is when every mother, every child, and every Nigerian or any resident of Nigeria, wherever they are, have access to quality health care. And they are not overburdened by out-of-pocket. And that is why I really want to also commend the effort of all the agencies. MPACDA, thank you for the good work you're doing. NHIS, thank you. And my brother from FCT, kudos to you. And talking from the citizen's perspective, HP Plus actually enhance a space that in civic space that actually has been shrinking for a while. And when you talk about civil society, people tend to see civil society as adversaries or as opponent or as opposition of government. But rather, the Basic Care Provision team, the HP Plus and the other agency saw civil society as critical stakeholders, people that come to the table not to oppose them, but rather as people that bring solution to the table. And that is why from the inception of planning, civil society has been at the forefront. And for us to also mention that even the Basic Health Care Provision Fund we are talking about today is a product of a National Health Act that actually emanated from a very active civil society movement led by Health Reform Foundation of Nigeria and HSRC, a Sector Reform Coalition. And till now, they are still leading that. And we know what happened in 2018 with the support of when we actually had to advocate and ensure that it's not included in the budget. So this has been a conversation that civil society has been at the center and at the forefront of driving the implementation. And that's when it was finally put in the budget in 2018. Civil society were part of the process, but significantly, more significantly beyond just going for meetings and trying to ensure all the stakeholders, the government partners come to the table and have a common goal and they are actually being held accountable. Civil society were part of the design of the manual in itself. The input of civil society ab initio was included. You know, it was subjected to participation. At National Council for Health, civil society were part of that conversation. And even when the current review was done, we were part of it. So you see that civil society has been at the core. Now, ab initio, the current review, the training, civil society were part of the training. And, you know, I'm so delighted to say that, you know, just now when they were training the facility health workers, because they realized that the people needed to be part of it. Civil society were invited along with the community people, the WDCs. And this is one of the trainings where you come and you realize that, you know, languages, terminologies were broken down to the level of the people that needed to be able to use it. You know, it was more of an inclusive and well-integrated approach in where diagrams, role plays, you know, was actually adopted. You know, adult learning conversation came to be very strongly. Also, another thing that came was also the capacity building of CSOs. Now, when the manual was developed, CSO was also part of the step down that was done for the various agencies, because one question comes along, okay, if you want civil society to hold the system accountable or to follow through or even to advocate, they needed to have the understanding of what they were advocating for or what they want to hold or what they want to track the system for. So you don't actually shave somebody's health behind them. So what they did was also mobilize across all levels from the national TOT down to the various gateways training, down to the state level, subnational. CSO were part of it. And actually this now built the capacity of CSOs that were actually now included on the various technical working groups. When we had the Ministerial Oversight Committee at the national level, there's a civil society seat. At the state level, there was a civil society. And even ab initio, when there were issues about capacity of civil society, ability to even engage issues of health financing, I know because of the training I've been part of the Basic Health Care Provision Fund training across the different layers, these civil society now had the capacity to actually engage, not just longer going to the meetings and just taking the attendance and sit, but they were not able to actively engage with the process. Also, the engagement has led to what we also, you know, in terms of work plan. Now, what we are now seeing is that we now see a lot of civil society, both at national or at the state level, even down to the community level, now including Basic Health Care Provision Fund as part of their activities. There's now a sense of ownership in trying to say, okay, this fund is for us, and we must ensure that it works and people are not following it by themselves. And that is why you see that there's been a lot of clamor, a conversation around basic care working at the community level. Also, one of the things that we can actually say that has been very, very vital for us is also that because all this conversation now led to increased citizen ownership and increased citizen participation, which has led to accountability. Now we now see one of the things that civil society are now doing based on the support that we receive is also, you know, we now see various organizations coming up with scorecard and using some of this scorecard and engagement to advocate. And I'm happy to tell us that one of the things that we've now doing is that, for example, in FCT, we are collaborating with the FCT Primary Health Care Board to advocate for the implementation of the FCT Primary Health Care Bill. Even the FCT Health Insurance, we are working with them. So, and this actually action trickled down across the different layers. So the opportunities that we've gotten, the sustainability is there. But one thing that I think is important as a key challenge is that it's important that we start integrating civil society as a key component of conversation, not as an addendum to the conversation. in terms of planning programs, civil society needs to be part of it. Support needs to come in, because when we're talking about civil society continue to do this, how do they continue to work after the project? Because the sustainability is not just about them doing the activities, but how do they ensure they continue to do it for longer time and in a way that results are well measured and they are delivered to Nigerians. Thank you very much.
Thank you very much, Anu. And we're delighted to hear that the capacity strengthening that HP Plus provided to civil society, as well as making sure they were included in the trainings and the manual development and also the town hall meetings and all of that, is actually yielding effects, even 2 years beyond when that support was given. Now civil society have these things in their work plans, but they are even taking, initiative and developing accountability frameworks and doing other things as a result of their capacity strengthening. Thank you so much, Anu, for that excellent submission. So I think we just have time for a couple of questions from the floor, and then we'll come back to the panelists to address the questions and then give any final parting shots.
Okay, good afternoon, everybody. My name is Richard Onyebowa. I represent Advocacy Program for Touching Lives. It's an NGO, and I'm so delighted hearing from our sister the role and the capacity building for civil society. But in forums like this, we talk, but what we see at the grassroots is completely different. So much has been said, but my question is particularly based on what Dr. Dan Fulani said. It is his wish that health coverage will be extended to the less privileged and vulnerable people in every part of Nigeria. But our concern in our NGO is actually what has been done or what could be done to vulnerable women and children in places where we see devastation of hostilities, like the issue of banditry, Boko Haram, and the rest of them. These are people. We can stay here in Abuja, it is safe. We can stay in the comfort of our home, is safe. We may even have cash to spend when we have any little thing. So please, what could be done to people in those areas? Thank you.
Thank you so much for that. And I think the issue of equity and coverage remains very vital. Without peace is very central. And that is why we look at the issue of human capital development. We realize that beyond health and education, peace, security forms a very critical core. And we need to continue to preach peace. But now in terms of equity and access, it's important that is why you see the basic, the PHC system is meant to be close to the people, and in bringing it very close, and because you're talking about the vulnerable people at risk, it needs to be close, and that is why they also need to enroll, and the community system, the WDC system with each community will actually now adopt a local or convenience system for themselves to see how can they actually get out of these systems to see where. So I know I've seen cases whereby there are insecurity, but they have conversations with sometimes, communities know what the issues are. And when some of these issues emerge, they say, look, let's save the life of a mother, let's save the life of the child. And those conversations have actually gotten them to say. And we've seen whereby because of this conversation, community ownership, they try to even keep facilities and education centers safe from destruction. So this role of citizens is very, very important. And it's actually through education. When we continue to mobilize education, educating people, we need to continue mobilizing community ownership of initiative of government. So they don't see it as that is government, this is all. So one of the things that this intervention have done is also building trust in the system. Because when you don't build trust in the system, even when the care is there, you find out that people do not go there. So it's a whole consortium of action and process. But I think Dr. Fulani would also like to talk in terms of the informal sector engagement.
Yeah, also to speak to your concern about the children, pregnant women, and a lot of vulnerable people in areas of conflict. I'm aware that most of my colleagues, especially the Northeast, North Central, in their social health insurance scheme, the state has ordered that all the people in IDP camps and where they can access. You know, also there is limit to what, even when we are registering for basic healthcare provision fund in FCT here, we have no-go areas. And I know, you know, when we are doing that, there are no-go areas. Nobody will go to an area where the indigenous cannot go. So as I speak with you, many states now, in those conflict-ridden areas, they have instructed their social health insurance scheme to enroll all the people in IDP camps, and that is being currently done. They use their equity fund to ensure that they are engaged in their state social health insurance scheme. So that is taken care of. Aside from the fact that one of the major concentration of focus for basic healthcare provision fund is women and children and anybody who is in conflict area. So they are your priority anywhere you find yourself. But we must also agree that from the funding available, there is still a gap, which I don't know, maybe HP Plus can help us to close that gap.
Thank you very much, Dr. Fulani. So at this point, I would like to invite the panelists, 20 seconds each, if possible. Give your final statements if you have any, and then we'll bring this panel to a close.
So thank you so much. I think one of the things we need to talk about now is capacity building and continuous support for civil society, innovative way of building capacity of civil society. We can't bring more than maybe 50, 100 to one hall. So how do we start using technology to build capacity of civil society? And how do we also have flexible funding for civil society and the communities, not just the Abuja and the Lagos or Port Harcourt CSOs? And that would be a very great way to build capacity across and for us to continue doing our bit of work.
Yeah, for me, for anything at all to succeed, the leadership must be right. When the leadership is right, when the leaders and the political elite has a buy-in for whatever we are going very far. For health system in Nigeria, human resource for health is still a major challenge. If you like, vote 10 billion, vote 10 trillion, and there are no people in the lowest services to deliver these services, you are wasting the money. So, when the National Primary Health Care Development Agency is going to be working on the primary health care sector, the human resource for health is critical. The services in the primary health care center is standing on 3 footing. The number 1 is the human resource for health. The number 2 is the infrastructure. The number 3 is the commodities. If the commodities and facilities there and the human resource is lacking, is zero. I wanted to make a presentation and I have to go around some of the health facility in FCT. There are beautiful health facilities being built in FCT. Very beautiful in terms of everything, but it's closed down 24 hours. So that is important. And then thirdly, we, the handlers of health, we must also prioritize our contributions. We must give health. Let's know that we are giving health to our people. Let's speed up our support. And then health insurance should be number 1 in the priority of healthcare system in Nigeria. Thank you.
Thank you very much. My parting shot is this. Just as we have worked together to make sure that the National Health Act was passed into law, we worked together to make sure that the Basic Healthcare Fund was operationalized, and we worked together as civil society, NGOs, states, federal, everybody, all the agencies work together to make sure that we operationalize the BHCPF. We need to make sure that the gains, what we have learned from the experiences so far, are sustained, that we do not let it go to waste, that we need to also make sure that going forward, we leverage on the capacity that has been built, and we continue to expand on that. We also need to make sure that health insurance is made mandatory. Somebody must pay for healthcare. It's not free. And we also need to make sure that facilities must be available to people. Geographical access is key, even in those areas that are devastated by conflict and other things, so that people can access the health care that they need without being affected by catastrophic health expenditure. So there's still a lot of work to be done. Leadership is key, like Dr. Danfulani said. Synergy is also key. That broad partnership between the private sector, the development partners, government, at all levels is very important too. Thank you.
Okay, thank you. I think I'll just keep mine simple. First is thank, on behalf of the MPC, really thank HP Plus for the support, particularly at the start of the Basic Care Provision Fund, and really to emphasize that we do need our partners. They are extremely catalytic and useful to what we need to do, but to call more for that alignment with government's priorities, particularly in terms of information and data sharing, so that when we have partners working in the state, so if I know that HP Plus or related program is implementing BSPF in a state, like I know that state is covered. I will get the feedback of what's going wrong, what's going right, and what we can scale up to other places, and not have to call for a special meeting to do that. So that integration into government programming with government in the leadership is most critical, and we hope that's a lesson that can be taken forward. Thank you.
I think this panel deserves a better round of applause, please. Thank you so much, distinguished panelists. I think Dr. Obe has actually given an excellent summary, so I don't need to go over that again. But he keeps, and all the other speakers emphasized the need for aligning with government, capacity strengthening, leveraging on existing policies, integration, partnerships, and all the other excellent methods and approaches that HP Plus has used, which has led to results. So the call is on everyone now. There's a lot of work to be done. So as we move into this future, let us take these lessons from this highly successful USAID-funded Health Policy Plus project to make sure that this impact is actually felt across the whole of Nigeria, not just in HP Plus supported states and at the federal level. Thank you, and thanks for your time.
Ladies and gentlemen, to moderate this next panel session on sustaining Nigeria's HIV response is Ure Ihekanandu, Health Financing Officer, HP Plus Nigeria. Please put your hands together for the very delectable Ure as she comes forward to invite the panelists.
Thank you so much, Dr. Francis, and the panelists for the very robust insights on advancing universal healthcare coverage reforms in Nigeria. So this panel session is going to be, specifically focused on the HIV response in Nigeria. So talking about how can we sustain Nigeria's HIV response, mobilizing domestic resources for the HIV program in Nigeria more than ever. Just to provide a bit of a context before I invite the panelists to the podium, just to say that, please, the slide, thank you. Just to say that we all know here that HIV is a huge burden in Nigeria, and its response is heavily reliant on donors, with donors contributing over 80% of the funds for the HIV response in the country. The government of Nigeria, I think about 18%, and then the private sector just about 1%. And, just like we highlighted in the first session on the need for domestic resource mobilization, and then the government of Nigeria is actively working on this, and with the support of HP Plus, we were able to identify feasible, innovative strategies to mobilize resources for domestic resources domestically for the HIV program in Nigeria. Next slide, please. And in doing this, we're able, through our unique approach, just like Dr. Frances highlighted in her presentation, our unique approach of a focus on sustainability, locally led leadership, multi-sectoral collaboration. We were able to, develop with our support, the government of Nigeria was able to develop key, strategic policies that would enhance sustainable financing of the HIV program in Nigeria, and one of which was the National Domestic Resource Mobilization and Sustainability Strategy for the HIV response in the country, and the National Blueprint for HIV Integration into state health insurance schemes, which provides guidance on how to integrate HIV services into health insurance schemes. Just to say that while we were at the National Council on AIDS event yesterday and day before yesterday, these key strategic documents were really highlighted, to help support the HIV response in the country. Next slide, please. And just to provide a brief overview of the domestic resource mobilization strategies, the document highlights very key strategies for mobilizing resources, and that includes, how can we increase public budgetary allocations for the HIV response in Nigeria? How can we ensure efficient and effective use of the resources we have in the country for the HIV response? And of course, how can the private sector financing come into play in the HIV response in Nigeria? And looking at local manufacturing of HIV commodities in the country. Just to say that HP Plus, conducted a feasibility assessment on local production of HIV commodities in the country. We are currently working with NACA and the government of Nigeria to see how these discussions can be advanced in the country to ensure that medicines are available and, of course, for us to gain ownership in this domain. And, also looking at the governance of the HIV response. Just to say that key accomplishments, next slide please, key accomplishments have been made in this regard. We saw that with the implementation of this strategy, over $600 million could be mobilized from domestic resources for the HIV program in Nigeria. And just to say that Hiv Trust Fund, recently launched by NACA, has already, this has already been launched and is able to mobilize about $150 million for the HIV response in Nigeria. With the implementation of the strategic document on integrating HIV into health insurance scheme, Lagos is already implementing this with our support, and they are really doing very well in this regard. Over 216 facilities now, have been empaneled with about 190 facilities providing HIV services, and of course, helping them to expand health insurance enrollment. Over 600,000 people have been enrolled on the scheme, and they have access to HIV services, with over 13,000 HIV tests conducted. And this has just happened from the period of April 2021 up until now. To also support increased budgetary allocation for the HIV response, HP Plus also supported the Lagos State Control Agency for AIDS, in their public financial management processes. And this has resulted to increased budget performance for the HIV response in Nigeria. And just to say that domestic resource mobilization for HIV program is key. And we would like to discuss this further with our very distinguished panelists who will throw more light on how, HIV response in the Nigeria can be sustained. And in doing that, I would like to welcome to the podium Mrs. Josephine Kalu. Just to say that Mrs. Josephine Kalu is the Director, Resource Mobilization and Performance Management Specialist with the National Agency for the Control of AIDS. She has over 34 years of notable work experience in the private and public sector, a member of the Nigerian Institute of Management and the National Institute of Marketing of Nigeria. Mrs. Josephine Kalu is passionate about domestic resource mobilization and alternative funding for HIV. In her strategic lead role as part of the NACA team, she brought her experience to bear in the 62 billion naira private sector-led HIV Trust Fund of Nigeria, recently launched by President Muhammad Buhari. You're welcome, Ma. Please, a big round of applause for her. Also to welcome to the podium is Dr. Monserrat Adeleke. She's the Executive Officer of the Lagos State AIDS Control Agency. She's a medical doctor and a public health specialist. Dr. Adeleke is proficient in program design and implementation across various sectors aimed at improving the general health of the citizenry through public health interventions. She's experienced in coordinating, engaging, and liaising with stakeholders from the national, state, and local government levels and the organized private sector on diverse health programs. As the CEO of ELSACA, the agency tasked with coordinating the state's HIV and AIDS response. She led the team that coordinated the dissemination of the 2018 Nigeria HIV and AIDS Indicator and Impact Survey result for Lagos State. And this is a first of its kind in sub-Saharan Africa, and this has subsequently aided in targeting coordinated interventions to mostly highly burdened local government areas in Lagos State. And she's also passionate about sustainable HIV financing. Please, a big round of applause for her. Welcome, Ma. To also welcome Dr. Emmanuela Zamba. She is a medical doctor, public health expert and health system strengthening specialist. She has vast experience in healthcare planning, human resource for health, quality and healthcare management, health financing, public-private partnerships, and policy development. She has actively championed and led the universal health coverage movement in Lagos State with an excellent understanding and hands-on expertise in context-appropriate strategy designed for financial protection and expansion of population and service coverage. You're welcome, Ma. Thank you. Also, we want to bring up our donors too. I would like to invite Mr. Peter Egena. He is a program specialist on domestic resource mobilization at the USAID Office of HIV and AIDS and TB. As I said, he'll be sharing with us from a donor's perspective. Please, a round of applause as he comes up. You're welcome, sir. Also to welcome Dr. Jeku Ozoemene. Dr. Jeku is a thoroughbred executive with a wide range of experience in the Nigerian and African institutional, commercial, and investment banking industry. He has proven leadership skills involving managing, developing, and motivating teams to achieve their first objectives. He's dedicated to maintaining high quality standards. And just to say, he's the CEO of the HIV Trust Fund recently launched. You're welcome to the podium, Dr. Jeku Ozoemene. Balance. Thank you very much, panelists, for making our time to be here to share with us from your experience. So my first question is to NACA, Mrs. Josephine. So the National Agency for the Control of AIDS developed a National Domestic Resource Mobilization and Sustainability Strategy for HIV epidemic control. So why was it important to develop this strategic document? And could you please share with us your experience about the successful partnerships and enablers that helped you achieve this great feat?
Thank you for staying on since the session started in the morning. I would like to say that sustainability of the HIV response is at the very forefront of Nigerians' plans. And we have the Economic Recovery and Growth Plan. We have the National Development Plan 2021 to 2025, and other plans that attest to the fact that sustainability of HIV response has been prioritized. The development of the National Domestic Resource Mobilization Sustainability Strategy is key, because that will help us now to drive our efforts in the right direction to ensure that we're able to walk the talk. And the strategy, of course, articulates very clearly very strategic and innovative approaches that can be utilized to mobilize, like was said, just before we were invited, over 600 million dollars. Clearly, the process of drawing up that strategy brought out clearly what the financing gaps are, and also what is required to see that the government takes more ownership, and then we depend less on our partners. The partners have done a lot over the years. We know PEPFAR and Global Fund are the principal funders of HIV, and of course we've made a lot of progress. But how do we sustain the progress? now that we know that the partners are beginning to draw the curtain. Of course, in terms of partnerships and support that we received to develop this document, I must say, proudly so, that USAID supported Health Policy Plus project gave us very, very extensive support throughout the process of the development. They were there besides us when it was also launched sometime mid-year last year. But to also say that in the course of developing the strategy, there was need for multi-sectoral collaboration. So working through national, state entities, of course working with donors and partners, working with CSOs, and of course the private sector. There was extensive collaboration to put together the strategy, which is key in ensuring too that in the process of implementation, you also will have a greater involvement that will give us the needed push that we require to ensure that not only have we articulated the strategies, but we're actually able to implement and carry them out. Thank you.
Thank you so much, Ma. Just to thank you for your response, and just to say that this strategic document has been adopted for implementation across the states in Nigeria. So it's good news that the federal government is wanting to ensure sustainable financing of the HIV response in Nigeria. Thank you for that response, Ma. So one of the key strategies highlighted in the document is, to increase public sector financing for HIV, for the HIV response in Nigeria, is the integration of HIV services into state health insurance schemes. And this is already being implemented in Lagos. So my next question goes to Dr. Emanuela. Lagos State has successfully integrated HIV services into the state health scheme. Could you please share with us your experience in integrating HIV services into the scheme? What are the successes so far? What are the challenges, and how did you overcome them?
Thank you for the question. I won't say Lagos State has successfully integrated. We have successfully started because it's a 5-year roadmap, and we're marching forward, definitely. Yes. How did we start? Well, we had a roadmap that was developed in 2020. HP Plus also supported this endeavor. And once we had the roadmap spread across 5 years, for us to even start thinking about integrating it into the package, there was a need to have an actuarial analysis done. And that started, I think, in December of 2020. And by mid-year 2021, we had finalized the actuarial analysis, had it validated, and we were now able to, with evidence and science, now know what could go in without affecting the cost in terms of the premium, and looking also vis-a-vis the number of people that were already on the scheme. So how are you going to grow that trajectory? So by 2021, we started the support of ELSACA. I will say that's something that Lagos has enjoyed. We have very fantastic intersectoral collaboration. So between ourselves, ELSACA, and even the ministry, we were able to build capacity of providers. I think at the last count, we have about over 180 of them who have been trained on HTS. With the approval of Mr. Governor and the support of ELSACA, we were able to now start providing test kits to these providers. And so HTS services started within the health insurance program. I think till date we have about over 12,000 of those tests conducted so far since we started, which is very good. Clap for Lagos. Okay. We went a step further in terms of now looking early this year, what else can we add apart from the aged, which is now it's not just providers doing the services where indicated. You now have client-initiated testing, and we've also introduced service charge, whether it's for consultation, you come for counseling or your ARV refills, we have introduced service charge. And as I said, we continue to titrate as the numbers grow. Using the actuarial template that we have, we'll be able to continue adding using the roadmap. I also want to mention the fact that we've also empaneled, I think there are about 6 facilities in a particular network, Heartland Alliance, who provides care for HIV. They are now empaneled under the scheme and providing services, bona fide members of our list of providers. We've also, with the support of another partner, been able to enroll children and their families who are HIV positive. As at last count, we had 4,000 children that's been supported by the Equity Fund of Lagos State and their families. So it totals about 7,000 people that are now enjoying that support in Lagos State. So we're very big about HIV. We are looking to see how we can make the vertical horizontal in the not too distant future. When it comes to what our successes, I've mentioned those. We had a very enabling environment, let me say that. We have a governor who is very big on UHC. He happens to be married to a medical doctor, and she is one of our champions for UHC, so we've had his support from the get-go. We've also, as I mentioned, the intersectoral collaboration with other MDAs. That has been something that we've enjoyed. I will also say the fact that we're quasi-private. We have a board, and because of the revenue that comes in, we were able to headhunt and have ensure that we have a pack of skilled people to help us achieve our mandates. So I beg, well, I'm looking for anyone to disagree with me that Lagos State does not have the most formidable team in terms of a health insurance agency, in terms of bringing in people that have the requisite skills and capacity. So you're already starting from a very advantageous position, and you're just building on that as we go along. I think I'll stop there. Thank you.
Thank you very much, Dr. Emanuela. You've really highlighted very salient lessons that other states can actually learn from Lagos. And I would just like to highlight that intersectoral partnerships is key. You know, you made mention of NACA, the LSACA, HP+, and a host of other people that have helped you to achieve this in Lagos. And we hope that other states watching can actually learn from Lagos to do this in their own states. Okay, so I will move to LSACA, the Lagos State Agency for the Control of AIDS, Dr. Adeleke. So the sustainability of the HIV response requires mobilizing domestic resources to reduce the country's dependence on external funding by strengthening public financing for HIV/AIDS at the state level. And Lagos State has also been successful in this regard. They have changed the narrative with regards to domestic resource mobilization for HIV. Could you please share with us the enablers for this in Lagos State? Not just the enablers now, but what were the challenges you encountered and how did you overcome them to achieve this in Lagos?
Thank you very much. Please don't mind my voice. So basically in Lagos State, how we forged ahead to increase public funding for sustainability is basically what the GM has also said. I think it's the strong political will of Mr. Governor of Lagos State. If you don't have the political will, you would not be able to increase budgetary allocation to the HIV response, which is what is being experienced in Lagos State. Because of Mr. Governor, we have gradually increased budget reallocation. From the year 2019 when he came in, we increased budgetary allocation by about 25%. Then following that year, we also increased by 7.2% because of COVID. You know, there was not a lot of things that happened. But even from 2020 to 2021, we also increased by about 12.5%. So Mr. Governor has always continued to increase funding as in allocation because he is aware that there is dwindling of donor funding and he knows that there is donor fatigue. So we're looking towards that. Now, basically, another thing we do is that we ensure that since we've had this budgetary allocation, we front-load proposals quite early in the year so that it would have time to get quick approvals and releases. We're very big on releases in Lagos State. And like we did mention earlier, strong intersectoral collaboration between the line ministries and the agencies. Because if you are doing all of this, you are getting approvals and you don't have releases, you will not be able to implement anything. So the Ministry of Finance, the Ministry of Economic Planning and Budget, we have a strong relationship with them. They know the significance of what the HIV response is, so they are with us and they release quickly. We've had policy, health policy plus supporting us, because they also had advocacy visits to the Chairman House Committee on Health, so that he too knows the significance of why we should continue to increase budgetary allocation. They also paid advocacy visits to MEP. So I think this has all helped us for our budgetary approvals and the releases. So basically, I think this is all we've done. And then we have a work plan. We have the strategic plan that we follow 2021 to 25, where we strictly know where we're going, and is evidence-based programming. So I think all of this shows transparency, and it shows the successes and the results. So we document all the successes by rendering reports. This would help to make sure that you get further approvals. Of course, we've all had challenges, because you know that this is the political year. There's been a lot of, and then because we're just recovering from COVID, so obviously there were a lot of competing needs in the state. But even because Mr. Governor makes sure that no matter what it is, the HIV response will not reverse the gains that we've managed to achieve over the years. Because we started with the index case in 1986, which is about 40 years ago, but we're still having new infections. So everything channeled towards eradication of new infections by 2030, he's all for it, and especially with the 95 initiative. So I think basically all this has helped us, and that's why we're forging ahead in Lagos State. Thank you.
Thank you very much, Ma, for those very important points, and that is, you made mention of intersectoral collaboration again. That's a key theme here. Everything evidence-based programming, evidence-based advocacy, proper planning with the work plan at the beginning of the year, and all these, have contributed to the very good achievements recorded in Lagos State. Ma, you've shared, I just want to, ask further. I know you've made mention of the very good things, but, what are some of the challenges you've encountered on the way, and how can, other states learn from this, and how did you overcome them?
So basically, the challenges I said was everybody had a really tough time between 2020 and now because of COVID. Everybody was focused. If you see all the development partners, private sector, everybody contributed big to COVID. So obviously, a lot of programs fell through. But because of our own continuous advocacy, and we were documenting our successes, we set up a contingency plan. We had a WhatsApp platform, and it was with the development partners, the state government officials. We put Mr. Governor in it. We put the Deputy Governor, Honorable Commissioner, because we have a strong HIV consortium in Lagos State that was inaugurated by Mr. Governor. So basically, even during the lockdown and stuff, we were so active. We instituted a multi-month drug model where even our development partners were pushing the drugs to the HIV people. So nobody had any stock out and all of this. So I think because of all what we did, we didn't fall through the crack so there were competing needs, but they saw that HIV is still very important. So I would still say that it was advocacy and, forging ahead with all this documentation that allowed us.
This is really awesome. I personally love this. Thank you so much, Ma. So we'll move to the private sector. You know, one of the key strategies highlighted in the domestic resource mobilization strategy document is, you know, how do we improve private sector participation in funding the HIV program in Nigeria. And currently, funding from private sources contributes only 1% to the HIV response in Nigeria. And the HIV Trust Fund is an innovative financing mechanism expected to mobilize funds for the HIV response through the private sector. Dr. Jeku, what is the potential of this trust fund, and how could it help to improve funding for the HIV program?
Thank you. I think it's important to note that HIV Trust Fund, as currently structured today, is not in place to replace the work or take over the work of the existing donor agencies that have been supporting us over the past 2 decades. The HIV Trust Fund is a response to a plea from NACA to the private sector. And NACA had dimensioned what was happening in terms of domestic resource mobilization and participation from support from donor agencies, and of course the fiscal challenges that government is facing in terms of funding programs. Based on that, a presentation was made to the private sector, to NIBUCA specifically, the board of NIBUCA, which is Nigeria Business Coalition Against AIDS, explaining the situation and the need for the private sector to play a role in terms of domestic resource mobilization. So based on that, that's the premise for the setup of HIV Trust Fund of Nigeria. Now, what we have done over time, working with NACA, is to dimension what the need is, and to the global need in terms of HIV/AIDS interventions, and then determine that at this point in time, the HIV Trust Fund we don't have the capacity to do everything. So we are going to focus on just one aspect from the entire thematic space, and which is the prevention of mother-to-child transmission, right? And there was a reason behind it. You are aware that despite the fact that Nigeria has done incredibly significantly well in HIV/AIDS interventions, one area where we have not done fared too well is the prevention of mother-to-child transmission. And the analogy we give today is it's like in a game of football, you have strikers who are scoring goals for you, right? And your goal post is open. So today we've determined that we have about 1.9 million people living with HIV. About 1.7 million of them are on antiretroviral therapy. But if every year you have 22,000 infants coming on board again, HIV positive, it has the capacity to erode all the gains you have made over time. So is this area that the HIV Trust Fund of Nigeria has decided to focus on? Since our launch in the last 4 days, we've tried to dimension the funding gap in the PMT, prevention of mother-to-child transmission space. We've determined what it is for this year, and we are going ahead to commence our roadshows to our various stakeholders. So what you will see coming from us is that over the next 5 years, we will begin to claw back as much as we can in terms of interventions in the prevention to mother-to-child transmission space. So that's what you will see. We have a global target of $150 million. Of course, we won't start year one with $150 million. The ideal fund structure will be to raise all that money in 1 year, right? That's the ideal fund structure. But we all know that nobody has given the private sector any money to hold and say, please give us our money. It'd be beyond that. The same private sector is involved in several other fundraisings to support government, whether it's in kick out malaria, whether it's in defense, whether it's police, whether it's COVID, etc. So there are so many programs that are competing for needs. In fact, one of our donors told us that every year they have dimensioned how much money they want to use to support various interventions. So depending on your pitch and what is most relevant, you will get some allocation for it. So that is where we are. We believe that the more we talk about HIV/AIDS in Nigeria in the language that we all understand, the more people realize that we have a burning platform moment. And I keep reiterating the burning platform moment. So everybody in this room, we require the support of everybody in this room. oftentimes when we talk about HIV/AIDS to people who have the capacity to open their wallets and support us, they tell you, oh, we didn't know that we still have a HIV/AIDS problem in Nigeria. So what we tell them is that you don't hear about it because somebody is paying for it. As soon as the person stops paying for it, then you have a potential crisis on your hands. So that is the language and that's the communication we need to keep pushing out there, that the guys who are paying for it are saying they have been paying for 20 years, and at some point they're going to step aside, and then we need to begin to claw back and take over some of those responsibilities. So that's where we are today. Thank you.
Wonderful. Yes. Thank you very much for your response. So to the donor perspective, Mr. Peter, USAID has been investing in domestic resource mobilization and health system strengthening efforts with a focus on localization and sustainability. Why is it important to reduce donor dependence and, of course, ensure the sustainable financing of HIV in Nigeria?
Thanks so much for that, that question. Actually, from the question, you actually answered. You were asking the question, and you were answering the question. Because there is a need for us to begin to take full responsibility for our programs. HIV is a case in point because all along it has been like more or less a vertical program, and it's time for us to begin to integrate, and it's time for the people who are paying for most of these services now to begin to see that, yes, we have pushed, we've been able to bring the people up to this particular level, and now they are beginning to take more responsibility. And because the truth of the matter is that globally, priorities are changing because things are happening all over the whole place. Don't need to start mentioning different hotspots, all manner of things are happening there. So priorities are changing. And by now, I mean, I've been supporting Nigeria. The PEF actually come about since 2003. Globally, we have been in Nigeria all along, and we've been supporting the government all this while. I think it's time for our, the taxpayers who are actually using their money to support the country to begin to say, yes, this country has come of age, they're beginning to do some things to show that, yes, they are coming up. Apart from giving us the leverage to be able to do the program the way we can, because it's our people, so we need to really take full ownership. So that is what, from our perspective as donor, that's the kind of thing we want to see. And we're happy that it's already happening, just like the last speaker spoke, with my director of resource mobilization from the NACA side and all the other partners here. We need to see that already happening, and we are interested to see more of it happening. We happen with the result from Lagos State. How I wish every other state could be like that. I mean, we would have been able to say, okay, if, for example, every state in Nigeria is bringing like, say, 200 million. By the time you multiply 200 million naira by 36, you know that is huge. And you know that it would have gone a long way to really, I mean, question what we're talking about. So for us to be, for the program to be sustainable, for us to, I mean, to advance the risk of, say, okay, maybe program failure in the future. I'm not saying that everybody is, we are dropping the ball now. We're not hoping to drop the ball. But that 1% of Nigerians, because if you take out the percentage of the population of Nigeria, about almost 1% is HIV positive. That 1% is very, very critical to our economic development. We need to see that, yes, locally, we are thinking about these people, and we are concerned about them, and we are doing something about it. So that's just the donor's perspective. Thank you.
Thank you so much, Mr. Peter. I mean, you've already started, delving into my next question for you, but we've recorded successes in Lagos and, with the support of the Health Policy Plus project. But, how can USAID leverage on the lessons learned from the HP Plus project to scale up DRM efforts, across the country at the subnational level?
Okay, that's that question is a little bit difficult. Difficult in the sense that, yes, we want to scale up, right? I don't start calling numbers, but we are also limited to, because just like I said earlier, we have other competing things. For example, everybody COVID is one of the things that just came up and shifted a lot of attention, just like what Dr. Adeleke mentioned. the US government is putting so much money, so much energy into COVID, just like most of the other people, because it's an immediate emergency and something that they feel they can just nip it at the bud. So it's some of the things that are actually taking a lot of attention of them. But that said, we plan to actually continue with this because we are glad to see that when we see results for investment, it actually motivates you to invest more. And it's some of the things we are hoping to be able to take beyond just Lagos. And hopefully as the year moves on, as the new program that's following on HP Plus comes on board, we hope to be able to expand to some states. I'm not going to name them now because a lot of things comes into this. It's a little bit, there's some political aspect of it. There's also some economic aspect of it. Also some of the things we're going to talk about here now. But for sure, we are looking forward to actually expand. Thank you.
I'm really glad to hear this news that USAID is looking forward to expanding implementation of this across other states. Thank you so much for that excellent response. To Dr. Zamba, we are running out of time and we'll just take some questions and then get questions from the room and then we'll wrap up this session. Dr. Zamba, what are your expectations for the future with regards to expanding health insurance coverage, which I know is a priority in Lagos State, and of course, fully integrating HIV services into the Lagos State Health Scheme Benefit Package? So what are your expectations for the future, and what kind of partnership and support would you need to continue to achieve greater feats?
Fully integrating HIV into the package would require, of course, expansion of the pool of people that are under the scheme, certainly. A lot of conversation went around regulation in terms of making the health insurance mandatory and some level of enforcement. Yes, it is mandatory in majority of the state health insurance laws. However, enforcement is another issue entirely. So we are fortunate in Lagos that our law not just talks about implementing a social health insurance plan, but it also empowers the agency to regulate the health insurance space. As you know, Lagos State has a very vibrant private health insurance industry in Lagos, and so we cannot move forward without bringing them on board as partners. So we would, I must say though, HP Plus was the only partner in the coalition of partners that we have in Lagos State that stepped up when we talked about wanting to start our regulatory functions. They stepped up and they supported us in getting us a consultant who examined the law, and we now came up with a regulatory framework. So we do have a framework, and I dare say that if we get more support in terms of implementing regulation, which would help us to enforce the mandatory nature of that law, that would help a lot in advancing UHC in Lagos State. I also want to say that I hope I don't offend some people in the room, but I mean, we're here to be frank. A lot of conversation has gone on about the BHCPF, and I think it kind of it distracts us from the daunting task of UHC. So it is a huge achievement for us in Nigeria, there's no doubt about that. But if you look at the numbers and the figures, it only covers maybe like 5% if we fully implement across board. And we have almost 70, in Lagos, our poverty rate is about 72%. So if we need to concentrate more on DRM and how you can come up with innovative financing mechanisms, BHCPF, where at least we've started, there needs to be more to do with how do you mobilize more resources to help you to pay for the vulnerable. Also, if you're going to do UHC, you cannot do that in isolation of social protection. We have, as I said, we've started implementing the equity fund, and we are on the field. We have a community-led process for identifying the vulnerable and building a database. And when you go into the community, so you're bringing free health, fantastic. But they'll tell you, we need food, we need money. If you do not bring a facility literally almost to my doorstep, and you expect me to pay for transport to go to that facility, that is another cost that you're not paying. If you understand what, so there are hidden barriers, even in saying that you want to provide so-called free health or free health insurance to the vulnerable. So we need to look at this thing in context and know that these vulnerable people have other needs and start trying to integrate those needs if we are going to successfully achieve UHC. I think I'll stop there. Thank you.
Very true. That's a good one. Excellent points. So let's move to the national level. Mrs. Josephine. The strategy document, that's the National Domestic Resource Mobilization Strategy document, has been adopted for implementation. So what are your expectations for the future, and what kind of partnerships and supports would NACA need to actually effectively implement the strategies across the subnational level?
Thank you very much. I'd like to say, for me, I think it's a good thing that on the last day of the National Council on AIDS, that we're having this event. Because just a few hours ago, it was approved at the National Council on AIDS that the strategy should be fully implemented. And in that hall, of course, we're talking about the importance of collaboration, you know, so we have the different state agencies or state AIDS control agencies, depending on how the nomenclature is across the different states. The highest level, the ESCs and the DGs available in that hall. We have our partners in the hall. We have PEPFAR, we have Global Fund in the hall. We have the CCM in the hall. You know, so many other implementing partners in the hall, CSOs in the hall, the beneficiaries themselves in the hall. And of course, the CEO of the Trust Fund in the hall. So for me, you know, the future is bright. I was there when the first domestic resource mobilization strategy was drafted in 2012, and it was on the shelf for a long time. And then it had to be revised. So the support we got from Health Policy Plus was to get it reversed and to move it to the point of implementation. So when Health Policy Plus came knocking, Suleiman Delda is here, came knocking to say they want to pay attention to domestic resource mobilization. For me, it was here or there, but now you can see truly that, you know, you worked with us since you came knocking to get us to the point where we're at. The fact also that the implementation has already commenced. Looking at the different pillars, there are 5 pillars in the strategy. And then, I mean, in the document as a whole, and there are then 12 strategies that we need to work on. And the fact also that the coming out of this document and the fact that even looking at integration, looking at HIV, looking at malaria, looking at TB, that also there is a HIV financing plan, sustainability plan, 2022 to 2027, that's also out. And the good thing was that most of the strategies were what was used as a base for that plan. And then some other practical approaches were also proposed. So I'm optimistic. The Trust Fund launched by the President. The fact that integration of HIV into state health insurance scheme, we can see the work that Lagos is already doing. I know there are other states that are also moving that forward already. And of course, one of the key strategies there is the local manufacture of commodities, and the fact that at the recent Resource Mobilization Technical Working Group, which also HP Plus supported to ensure that it's been inaugurated. So you could see so many things that have gone on. The Resource Mobilization Technical Working Group meeting just held barely about a week ago. So the momentum and the push, you know, gives one a lot of bright, you know, hope into the future that we're able to move it move things forward. Of course, the discussions around the local manufacture of commodities is ongoing. We need to also begin to partner with other agencies that are key, like NAFDAC and the rest, just to ensure that we move things forward. So really talking about challenges, I think as you see them, you also make sure that you are able to surmount them. And basically that some of the things that have been proposed in time past, we've seen some level of reluctance, maybe at the state level or pushing it through the National Assembly. But like I said, the fact that this document being put together, we made sure that in the course of the key informant interviews and all, so many people were reached. So we're looking bright for us at the national level, by extension at the state level. Thank you.
Please, this is a good place to clap. Thank you so much, Ma, for the excellent response. And I'll still, want to ask the other panelists the same question. Dr. Adeleke, what are your expectations for the future for ELSACA? And, what kind of partnerships and support would you need to continue to move things forward?
So basically, thank you. I feel that what we are looking forward to is to deepen the multi-sectoral collaborations that have been successful. Luckily, in Lagos State, we have a very strong Lagos State HIV consortium where we have the government, the development partners, the civil society organizations, and the private sector. Lagos State has a rich network of the organized private sector, especially through the Nigerian Business Coalition Against AIDS. We really, really work with them. And when I was saying one of the best practices that we had during the lockdown of COVID, we had a strong partnership and collaboration with NIBUCA. They were one of the first that supported the state in provision of palliatives for indigent clients, people living with HIV. And Lagos State was also topping that with them. So we were able to sort out about 1,000 indigent patients during the lockdown. So basically, we do a lot of capacity building with NIBUCA as well, where we train the human resource managers on workplace policy documents. So all of this helps us to continue to strengthen the response in Lagos State. We also have partnerships with the Fast Track City. Lagos State is one of the Fast Track cities in the world. We're one of the 15 cities that just joined. So we have the support of UNAIDS and IAPAC. So we're hoping that until it's over, because our markdown is to 2030. So yes, Lagos State may be doing well, but if you look at what National says, that we're about 11 million in Lagos State, meanwhile they know that we're about 26 million. So that deficit, we still need to strengthen our collaborations. So I think we look forward to, a sustained public-private partnership. So we look forward to benefiting as well from the recently inaugurated trust fund, whatever we can do to support and to enhance it. Like how they're saying we should tell our stories to let people know where the deficits and the gaps are in the response. At least we'll do it with them. So we have all of those partners that we're exploring, even the Global Fund and all of that. So our target now is to look at the private sector, even through Private Sector Health Alliance, ABC, things like that. So I think we'll continue to do that in Lagos State, using evidence-based programming, showing the success stories, working with our annual operational plans, the State Strategic Plan 2021 to 25. I think with that, we would continue to blaze the trail. Thank you.
Thank you, man. Excellent response. Thank you. Dr. Jeku, what support would you need?
So seriously, right now, there are two aspects to our fundraising campaign. One is the corporate, and the other one is the retail strategy. The corporate has kicked off. The retail strategy, just a few technical issues, and we'll start as well. Now, the retail strategy covers all of us here. So even amongst the corporates, we're also looking at the staff of the corporates, the individual, the average man on the streets. Why is the retail strategy important for us? It's important for us from a fundraising perspective, so every little kobo counts. but it's also important for us from an advocacy perspective, because he helps keep the discussion alive and out there on the street so that people understand where we are and what is required. So the support I need, everybody's support. First, I need, of course, the support of the patient community. I need the patient community to understand that this program is theirs and they will be involved in the decision-making of the program. The governance structure that we have today has a board of trustees that are comprising some of the top CEOs we have in this country, and of course the DG of NACA and the immediate past DG of NACA. You agree with me that these people have, they may have the hearts to drive this process, but they may not have the bandwidth in terms of time. So beneath that governance structure is a board advisory committee that has representatives of all the trustees. My director here, Justin, is a member of my board advisory committee. That is where the heavy lifting is done. Then beside the board advisory committee is a board technical committee that will be inaugurated immediately after the first round of fundraising. That is where you have the eggheads, where you have NACA, you have the partners, where you have the patient community represented. They will advise, will play a role in determining where the funding goes. So we are fully represented. We are fully gender balanced. I think the board advisory committee where the decisions take place is actually gender unbalanced because it's made up of mostly women. There's only one man there. So we may need to find another man to add to that committee. So the support, like I said, is all of us, the patient community, our existing partners. Thank you.
So I'll just take one or two comments, please. Okay.
Good afternoon, everyone. My name is Dario Felix. I'm representing Center for Health Works Development and Research, that's CHEDRES. Mine is less of a comment and more of a question. It's less of a comment and more of a question, really. So you were explaining the whole project to people that are like familiar with the whole HIV and stuff. How would you explain the same to someone with that mentality of thinking of HIV the same way they thought of COVID as a rumor and everything? How would you bridge that mentality from there?
So basically, if it's for health sector, well, it might be the most appropriate because we focus on community participation. We fight it at the grassroots level, and what we do is we continue to do multiple advocacy, public enlightenment, sensitization. All the time, we go to the religious leaders, traditional birth attendants, religious leaders, market women and association. We have this radio program that we do, and it ran for about 12 weeks. We just finished last week, and we do it in Yoruba. You know, in Lagos State, we have a lot of people that are Yoruba speaking. So we break down every single information about HIV to the grassroots. So they always disseminate it as well. Even when we do all these programs, we do a lot of outreaches to villages, urban areas, rural areas, you know, outreach and all of that. We have it transmitted even in Pidgin. We transmit it in local dialects that are in Lagos State. So we also have IEC materials that are not even limited to just the regular people. We are one of the first states in Nigeria that have IEC materials in Braille so that it covers the visually impaired and the blind as well. So we have, and the deaf, we train them as well. We do a lot of capacity building because we see they're vulnerable. We have a lot of engagement with our key population as well. So we have platforms that we reach everybody because nobody must be left behind when we're doing this HIV thing. So I think that's what we do.
Thank you so much, Dr. Adeleke. So we'll just wrap up here, and I just want to say a big thank you to you all for the very robust conversations here on how to sustain the HIV response in Nigeria. Thank you so much, Sazama. Thank you. Just to say that my big, a key takeaway here is multi-sectoral collaboration to ensure that we implement the strategies across, the country. Multi-sectoral collaboration is key. Evidence-based programming, advocacy efforts is also key. Thank you.
Thank you very much, Ure, and the panelists. We do appreciate you. Ladies and gentlemen, please let's give them a round of applause. Thank you. Distinguished guests, ladies and gentlemen, we have come to a point at this event where we'll call it a day officially. Special thanks to all who made it possible for this to happen. Well, I will be bringing someone who would give you the thanks the way you are deserving. So I would like to invite for a closing remark the country director, HP Plus, Dr. Frances Ilika. Please put your hands together for her as she comes forward.
This is quite commendable. And I must say I'm blown away. I'm really happy that we've been able to work together collaboratively as partners to achieve this. Please, I crave our indulgence. I'm not giving a speech. It's just a 1-minute thank you, please. Can we get seated? Hello? Please, can we get seated? Because it will be a crime for us to all disperse without thanking this amazing crowd that have been here to celebrate our successes with us. So I would like to start by thanking USAID, ably represented by the Deputy Mission Director with her very busy schedule, being here with the entire team, HIV/AIDS Office, our activity manager, Peter, who is here with us. And then, of course, Jeme, who is on maternity leave, who have actually created the perfect enabling environment for us that people have been speaking about. Of course, we must thank our AOR in DC, Vina, who has actually also made our work go very well with her team. We thank you, USAID. We thank you for the support. We thank you for making it possible for us to make this mark in the history of Nigeria. I would also want to thank the government of Nigeria, from the national level, the Federal Ministry of Health, ministries of the MPHCDA, NHIS, NACA, the state ministries of health, state health insurance agencies, state primary healthcare agencies, Lagos, SACA, including the 4 states that we worked in where we achieved the immense results that we got in the areas of RMNCH. The government of Abia State, Osun State, FCT, and Ebonyi. We must particularly thank the ESs of the agencies, the primary healthcare and state health insurance agencies. Dr. Ogini, who we couldn't play his testimony, but please, we still have those things on our website. Dr. Danfolani, who was here, and all the excellent ESCs of the different agencies at the state level, the excellent CSOs that we partnered with, the implementing partners that we partnered with, all the people that made this work possible. I must thank Palladium leadership. Sitting here right before us is Sunita, who came all the way for this event. Somehow when the conversation was going on about this end of project events, we wanted to have a very quiet closeout because we said, oh, we've exhausted all our money. We just have a quiet webinar and all of that. But Sunita said, no, the results we have achieved in Nigeria must be celebrated. because she's so passionate about Nigeria. You need to see the way that Sunita talks about Nigeria when she's over there, you know, in other countries, about how excellent Nigeria is. And that was why, of the 49 countries where HP Plus worked, she chose to visit Nigeria to be with us today for this end of project event. Thank you so much, Sunita. Please extend our thanks to the project leadership team of Palladium that have enabled our work. I shared an African proverb with Sunita. I told her that there is an African proverb that says that when the parents send the children on a mission, who knows the completion of that? When the parents send the kids on a mission, what will the kids do when they go there? They will kick down the doors with their legs because they feel the support of their parents solidly behind them. So just to say that all the successes we've been able to achieve is because of the excellent leadership and support that we have from Sunita and the project leadership team. I must also thank my indefatigable HP Plus Nigerian team. And please, I would like to invite them to come join me on stage. This is the point where if this were not to be a public event, I would have actually cried. Because this team have worked so hard. They have put their hearts in the work. Like we say in Nigeria, they have done this work as if it's their papa's business. Please join me to appreciate these wonderful, wonderful, wonderful people that I have had the privilege of leading on this journey. My only prayer is that this is not the end. We'll continue to work together by the grace of God. Of course, the excellent ladies and gentlemen that have been with us here to celebrate us, to be with us, to celebrate with us, to pick lessons, and to forge the way forward. All the excellent panelists that have shared their experiences. The visitors that we had to leave their very busy schedules to fly all the way from Lagos to be here with us. We don't take your sacrifice for granted. You must thank everybody, including people that sat in this room from 8 a.m. in the morning till now that is 3 p.m. We must thank you. Please let us appreciate our friends. What that shows us is that you are friends of progress indeed. And together we must work together to make Nigeria a better place. So thank you, everyone. Thank you to the people that provided the support, the back-end support. Thank you to the people, the ushers, the secretaries, and all the people that provided logistics support to make this happen. We have our finance team who provided excellent logistics support and everything. Thank you, thank you, thank you. I could stay here for the next 3 years saying thank you, but we have to go have our lunch. So I just want to appreciate everyone once again as we look forward to a brighter future. Thank you.